Recording in progress.
Never mind.
Recording stopped. Recording in progress.
The June 10th, 2025, the last day of budget hearing meeting of the Santa Cruz County Board of Supervisors. Will the clerk please call roll call?
Supervisor Martinez. Present. Cummings.
Here.
DeSerpa. Present. And Hernandez.
Present. Will you please join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I'd like to ask the county CEO, Carlos Palacios, if there's any late additions or deletions to the regular or consent agenda today.
Yes, there are two corrections on item 7 on the regular agenda. There's a revised staff report. It replaces packet pages 17 through 13. And then on item 10, there's additional materials. There's new attachments, 2025 through 2036 Cal Master, insert after packet page 190, and 2025 proposed fixed assets, insert after packet page 190. Those are, that completes the revisions to this agenda.
Would any board members like to remove any items from the consent agenda? See none, Will.
I'm going to pull item 12.
12.
Yeah.
So what's 12 going to now be? I got too many agendas here.
12 will become item 13.1.
Oh. Okay, we'll now move to public comment.
Chair, if I may consult with council, for the item being pulled, you stated 13.1. Is that correct to bring it to the regular agenda after item 10?
Your microphone's off.
So we're on the second meeting. There are 13 items on this agenda, yes?
I believe there are 10 items on the regular agenda and then 3 items on the consent agenda.
Thank you. 10.1.
Noted. Now we'll move to public comment. Sorry about that.
No worries. Hey, my name is James Ewing Whitman. You know, when you stand outside this building you see a US and a California flag. They do not have the gold maritime pirate fringe. I came in here a little bit before 1:30. I guess the meeting wasn't over. And I was curious what was going on because this was supposed to start again at 1:30, and I came up politely and called a point of order. And I was told something like, we don't recognize the public for points of order. I'll get to that. So I didn't stand up to the Pledge of Allegiance to the corporate maritime pirate flag. This has our Constitution. It doesn't delineate whether it's any of the three, but under Article 4, Section 4, the United States shall guarantee to every state in this union a republican form of government and shall protect each of them against invasion and on application of the legislator or of the executive when the legislative cannot be convened against domestic violence. So these individuals that I'm speaking in front of, and I'm referring to the elected supervisors, because this is under a charter management, a charter county or a charter city since before 1915, these individuals that the population voted for are under the yoke of an unelected, internationally controlled county manager. So this is really just kind of a farce. And it's possibly that when I call the point of order, that's really another reason for that. So anyway, it was great. I got to go back to the city of Santa Cruz and listen to some dialogue, and I was the first one to talk. And then here I am right on time. So it'll be interesting with the next item that comes up. I wish people were actually paying attention. I can basically give these away. My buddy buys them by the thousand. It's really useful stuff. Describes in here, our juror has more power than the Supreme Court or the president. They're all criminals. You know, the one currently is a very special kind of criminal. Thank you.
Good afternoon, chair, board, staff, and the public. I just wanted to make a comment around consent item number 11. Hopefully, you're willing to pull it just after this comment, because after reading this, it was my understanding that the savings from the probation department, right, with that was going to be specifically around the ranch camp, not combined with SYTF savings. So in that one meeting, those savings were because probation was gonna implement a ranch camp, right, which is funded through the general fund, right? So with SYTF, there's also grant money that's allocated for the RFPs and stuff. So there's general fund money and then there's grant money for RFP. So here's just, to me, it's just like, well, which one's which? You know, are you just gonna increase the RFP process, right? And then if that's the case, well, where's those parameters? Or, you know, it can't just be, I don't even know if you are able to like combine that money with grant money, and just really want more clarity around that, you know? So, and I know that we weren't able to be here during the third and the fourth hearing. So I know that Milpa was mentioned, and I just do want to say that whatever work that Milpa is doing with the young people that are justice involved outside of probation, because we are not contracted with probation, that is something that we've been doing from our effort, you know, and just looking forward to this RFP process and those savings of how we can support the work that we're doing, but not just us, other emergent organizations that are doing similar work, you know. So thank you.
Hello. I'd like to just follow up on what he was saying. It was also my understanding that the savings from the changes to SYTF were going to go to support less restrictive programs for youth, and specifically around supporting community-based organizations. So I'd love to make sure that that's still happening.
Hi, Pam Sexton, and yeah, I want to, well, I'm here as a teacher, as a parent, as somebody very involved in the Watsonville community in particular. And I want to thank you for the work that I understand you've been doing to find funds for the critical health services that are needed. We delivered to each of your inboxes, and I hope that you all read it. The letter, a sign-on letter with over 160 signatures, multiple organizations, and part of that letter it asks you to really think outside the box and look at creative ways to deal with our budget instead of just the same. And I also want to ask you to pull the item 11 probation to get more clarity. I have been following, I haven't been in the room every time, but I appreciate that they're videotaped and have been watching, and also have questions about how our general fund money is being used, and want to really see it dedicated to preventing preventing people from being incarcerated, to really just serve our community in the way that they need to be served. We should not have a jail that serves as our largest mental health facility, and their prevention is key. So thank you so much for taking that seriously, and we can do better. Thank you.
I'm not sure if this is the right moment, but this is regarding fees and permits. Is that something that's being?
Yes, but lift up the mic. There we
This
go.
is regarding fees, permits and fees.
No, that's later on the agenda.
Okay.
Yeah.
Anyone online?
Yes, Chair, we have speakers online. Andrea, your microphone's now available.
Thank you so much. Good afternoon, supervisors. My name is Andrea Carlos Willie, and I'm speaking today on behalf of the Pajaro Valley Collaborative, a consistent champion for equity and community voice to advance health, well-being, economic prosperity, and civic engagement for the Pajaro Valley. We are reaching out to ask for your leadership at this pivotal moment in the county's budget process. We respectfully request that today, when you adopt the budget or at the very next meeting, you prioritize the formation of a community-driven essential services equity task force that would be charged with looking at budget allocations using disaggregated data by race, income, age, and geography, evaluating service impacts on our most vulnerable communities, and delivering actionable recommendations ahead of the fall budget revisions. This will ensure transparent public reporting that aligns the spending with true community need. We propose that the task force be led by 2 supervisors, the county CEO, and include leaders from CPOs across multiple sector areas, include leaders from the Pajaro Valley and other disinvested portions of the county, and of course, senior county administrators. We are ready to work in partnership alongside the county to co-design a process that brings the county's equity statement to life. We ask that you do this work and build a lasting trust model that is bold and values driven in your governance. We hope you will champion this idea with and for our community. Thank you.
Call-in user 8, your microphone's now available.
What number are we on the agenda? Isn't number 7 for the afternoon agenda? Could you answer yes or no? I hear you talking about, huh?
Public comment.
I'm sorry.
We're on the
What
public
number?
comment for the items on the agenda.
Items not on the agenda.
Correct.
Oh, it's
And
public
consent.
comment for the afternoon agenda. Is that it?
Yes, this is afternoon meeting.
Okay,
Consent.
I'm unusual to see 2 agendas in one day. Thank you.
Yes.
Okay.
Okay.
So my comments are regarding the item about the cell tower.
That item has finished.
What? Yes, I know that. My main focus is promoting health and what helps our health and what doesn't. And the vaccines that have all these deadly injection ingredients are detrimental to our health. So is the radiation from various sources, broadband, cell towers, cell phones. And for you as a board to disregard the facts of the harm of radiation and toxic injections is really disingenuous when you talk about public health. Real public health has to do with a healthy environment, people having good employment, not living in poverty. Those are the kinds of things. And to waste money on vaccines and radiation emitting impose danger.
Kathy, your microphone's now available.
Hi, this is Kathy Lass from Aptos. I'm also echoing the call for clarity on the report back on the savings from the SYTF, or actually what we were asking for, savings on the ranch camp. So I do request that that get pulled from the consent agenda item number 11 to have more clarity on if we're talking about general fund money, grant money, savings from SYTF, or savings from the ranch camp. Thank you.
Positive Discipline, your microphone's now available.
Good afternoon. My name is Stephanie Bronlu. I am a member of the Pajaro Valley Collaborative, and I wish to uplift what my colleague Andrea Carlos Willie from PVUSD brought forward in terms of advocating for an ad hoc or a task force to bring our county's equity statement to life and lift up the budgetary process as one driven by our morals and shared values. I was one of the people originally charged with supporting the county in developing the equity statement, and I have to tell you, I truly believe that language has power, the power to inspire and to protect. We cannot achieve equity without clearly acknowledging who we are leaving behind. As the Executive Director of Positive Discipline Community Resources, I form part of various coalitions and collaborative, not just the PVC, but also the United Way Children's Network, our local Rise Together group out of the Community Foundation, just to name a few. And what all of these groups share is a common call to action to invest in children, youth, and families. There are incredible leaders with vast expertise that all share a similar advocacy thread, and I please hope that our board can have the grace and the space to really acknowledge that all we're asking for is clarity and transparency and a real invitation to collaborate on people-centered solutions. We all have our private logics. I've learned that through Positive Discipline, and I won't pretend to understand the full depth and the complexity of the budgetary decisions and the constraints that you face. But I do ask that you not do this in isolation, and please consider championing an essential services equity task force. Our Pajaro Valley leaders are not asking for things in silos. They are leaders that serve the full county and are on the side of justly co-creating a roadmap forward with structural equity in mind, centering disaggregated data to truly build a budget that reflects who we are and where we're going together. Again, language has power, and I really hope that you can really feel your power and either bring that forward for a future discussion or to champion it today. Thank you.
You have no further speakers, Chair.
I'll bring it back to the board for any questions, comments on consent.
Could I have 1 minute?
We already did public comment, sir.
Thank you.
I'll bring it back to the board. Supervisor Cummings.
Yeah. Quick question for our county council. So I was able to, I pulled item number, I believe it was 13. No, 12. Because I needed a clarification. I was able to actually find that clarification in the board agenda. Is it possible to just put that back on consent, or would we need to just have that heard?
So you no longer want to have item 10.1 as 10.1. You want to put it back on the agenda in its current place on the consent agenda as item 13.
12.
Was it 12? Yeah, as long as the chair agrees, then I don't think there's any problem with doing that if nobody else has any questions around it.
I did have one question, so I suggest we just keep it as 10.1.
Yeah, I actually, one thing that I was missing in that is that we just did public comment
and it
with the idea that 10.1 was going to be addressed separately. So I would recommend that you keep 10.1 on.
Okay, that's fair. I guess then the only other question I had was wondering if maybe if there's representatives from probation who could come up to answer some of the questions that were brought up. I think we can keep the item on consent since those questions were asked. You know, the people who spoke aren't going to be able to come up and speak again. So I think just having probation speak to those questions that came up, that way we can continue to move through with the agenda.
Did you have a specific question?
Well, there were members of the public who had, during comment, they had a number of questions regarding the secure youth treatment facility and the funding from that and how that funding gets allocated. And I know that we had a pretty lengthy discussion at the last meeting about how, you know, there's the optimum realized savings if, you know, all the children are back here versus, you know, kind of the reality of where we're at. And it sounded like that there was a lot of, you know, interest in these folks and better understanding how we could have some of those savings realized in programs with nonprofits within our communities. And so I'm just wondering if you could kind of speak to that topic that was raised rather than us pulling it off the consent.
I'll have our fiscal officer start first.
Yeah, good afternoon, Board of Supervisors and public. My name is Justin Nunes, the Departmental Fiscal Officer for Probation, and kind of the interplay between SYTF and camp placements is that we have a set amount of funds.
Can you speak into the mic too?
Sorry.
Thank you.
Here we go. Maybe I'll bring it up a little bit higher. So it is two different pots of funding, but the SYTF pot of funding, SB 823 block grant, is a set amount. So any costs that are unanticipated that go above and beyond that allocation get picked up by our general fund contribution. So that's the interplay between the two things. And what changed between the February board meeting where we reported an anticipated savings of $300,000 in the camp program was we had an unanticipated youth committed to Sonoma County. And that was an unanticipated cost that we estimate to be $140,000 for fiscal year 25-26. And that amount put our overall program costs for SYTF over our SB 823 block grant allocation. So that money needs to come from general fund dollars in our budget. So that's why we're revising our estimated savings number down from $300,000 in February because of that unanticipated placement that happened in March 2025. So the current projections are now an estimated savings of $160,000. And the point I'll make is that it's a point in time number. It really is subject to factors that are outside of our control. The court can make decisions between, you know, now and when we open our camp program. If an additional youth were to be committed to an out-of-county placement, that would further impact those estimated savings numbers, or it could go in the other direction too if you know, court was to order one of those youth at Sonoma to be released early. So it's a very fluid number, I guess, is what I'm trying to get at. But current point in time, as of today, we estimate $160,000 in savings.
Great, thank you. I just wanted to make sure that there was an opportunity for you all to respond to some of the concerns that came up from the community. So
I also had questions for them. Do you mind if I ask while they're up and then
I'm done with mine. So
okay,
perfect.
So thank you. I chose not to pull this item, but I was going to ask some follow-up questions as well because, you know, I have had some questions in the numbers and where the numbers come from. I understand that they are a moving target is what it sounds like. And I'm hoping that in a follow-up from the questions from Supervisor Cummings, you can still help me sort of land on the sources of funding. So I think I understand that the Secure Youth Treatment Facility is the real block grant. Now, for the ranch camp, what is the funding source for those placements?
General fund, yeah.
And when do you anticipate that the ranch camp will be opened?
Right now, we are aiming for September. I don't have an exact date, but right now we're working for I'm sorry, shorter than he is. We're working for a September opening of the camp.
And do you have an idea of how much general fund is put aside for that operating of that program?
So we basically tap into the general fund as a youth is committed. So we don't know, for example, last year, we didn't have any ranch camp commitments. And so again, we hoped, and we've had one who was not successful that has since come back and become a court commit. So those numbers just vary based on when a youth is actually committed.
So do you have any dollars kind of earmarked for, take, for example, the more expensive out of county ranch camp that, given that in September a youth could be placed locally, there would be savings because they're not out of county for the ranch camp side of things?
Yeah, so we set aside a contingency of 170,000, but that SYTF commitment is going to go against that contingency. So it's currently down to 30,000 in our 25-26 proposed budget appropriations.
Is that 30,000 above and beyond the 160 kind of holdback from the secure youth treatment?
Yes, I would say above and beyond.
Okay. Yeah, so I think, at our last budget meeting, I asked for further clarification and a report on the savings as a result of youth being placed in the secure youth treatment program. I appreciate that. Thank you for bringing that forward on this agenda item. I think that there's continues to be a lot of public interest in ensuring that those dollars are go to community-based alternatives through our CBOs. And it sounds like the plan is to do that through purchase orders. That's what I read in the report. So when it comes time to pass this motion, I will be adding additional direction to receive a report back at the mid-year budget report as to how the estimated 160,000 in savings for the fiscal year 25-26 is being allocated among CBOs for community-based alternatives.
Any further comment?
No, no further comment on consent, but I actually took time from Justin. So,
Oh, I think he was done.
Okay.
So if there's no further comment, I'll entertain a motion. Okay.
I have no more comments for you. So thank you. I appreciate that. But I have another. I'm going to go back to the consent agenda. So thank you. Thank you for your time. I wanted to respond to one more comment that we heard today in our public comment related to the request for a community-based task force as it relates to future budget actions once we have additional information of the federal and state impacts. That is something that I would support. I do believe that it's going to take a lot of diverse voices and minds and best thinking from both in the county and outside the county with our partners to figure out how we're going to preserve the safety net and most essential services if we face additional cuts. And so I will begin working in my office and perhaps with another colleague on the board to bring forward an item at a future meeting about what that task force might look like.
Thank you. If there's no further, comment, would did you entertain the motion?
I'll make a motion to approve.
The additional direction.
With the additional direction?
With the additional direction.
Second.
We have a motion from Supervisor Serpa and a second from Supervisor Martinez. If we could take roll call.
Could you just restate the additional direction?
To receive a report back in the mid-year budget report as to how the estimated 160,000 in savings for fiscal year 25-26 is being allocated among CBOs for community-based alternatives. Supervisor Koenig.
Aye.
Martinez. Aye. Cummings.
Aye.
DeSerpa.
I,
Hernandez.
can I just make a comment? So I understand that there's savings potentially from ranch camp. We can't ever determine how many kids are going to be sent there or sent to that level of care by the judge. But I, again, would like to caution us that when we find savings in this county, we should be setting that savings aside for what we know is coming in October. And I hate to say that because I wish we could just be very, very generous at this time, but I think we need to do some belt tightening and prepare for what is coming, what we know is coming in October, which will likely be more cuts. Thank you.
Supervisor Hernandez.
Aye, motion passes unanimously. Moving on to the regular agenda, item number 7, consider the approval of the proposed 2025-2026 budget for the Health Services Agency, including any supplemental materials and County Executive Officer's HSA budget, restoration recommendations, and take all related actions. I'll turn it over to Nicole Coburn, Assistant CEO, Jennifer Herrera, Acting Director, HSA, and Jessica Randolph, Director of Admin, for the presentation.
Good morning, Chair Hernandez and members of the board. Nicole Coburn, Assistant CEO. I'm going to turn it over to Interim Director Herrera to start off the presentation and give an overview of the Health Services Agency budget.
Thank you and good afternoon. If we go to the next slide, please. So we'll just do a reiteration of who we are as Health Services Agency, a review of our financial drivers, our proposed budget, our restoration options, and then recommendations. So just to reiterate, our mission at the Health Services Agency is to promote and ensure a healthy community and environment by providing education, outreach, and comprehensive health services in an inclusive and accessible manner. Next slide. As we discussed last week, as we had developed our budget proposal, we are faced with significant drivers leading us towards a financial deficit. Some of those drivers include grant reductions, such as the sunsetting of many of our COVID funding, low revenue in our clinics, low reimbursement rates in behavioral health driven by Medi-Cal reform, extensive non-mandated services, increase in program expenditures, increase in operational expenditures, and then, of course, the federal and state policy changes on the horizon. So here is a summary of our proposed budget. This reflects a decrease in our revenues and expenses. We have an increase in district sales tax of Measure K, and we have an increase of general fund contribution, which is reflective of covering salary increases as well as an additional approximately $400,000 provided to us to help minimize some of the budget impacts we've had. And we do have a reduction of our staffing levels of about 10%. Next slide, please. So again, the summary, we have a loss of $6.64 million in Health Services Agency revenue, resulting in a net reduction in $4.52 million with our supplemental changes. Our reduction of 74.4 FTE positions includes 11.6 FTE filled positions, which are primarily through our behavioral health. And overall, our FTE reductions are among our behavioral health centers in our public health divisions. So to meet budget this year, we have focused on mandated and reimbursable services. We have proposed to close our laboratory and radiology services in health centers, moving to a referral-based programming. We are proposing to end non-mandated services, such as funding for MHCAN, GEMA, and suicide prevention program. And we've also reduced our behavioral health room and board rates to align with state and regional averages. Since this last week, we have actually, as it was brought up in our discussion and public comment, we have reached out to Encompass over this past week to address the room and board rate issue, and we're confident that we have a plan for them to maintain Casa Pacific to be open while maintaining our proposed rate of $75 per day. And just a reminder that these reductions that we have proposed in our budget do not reflect the impact that we are expecting to see from federal and state policy changes. And with that, I will turn it over to Assistant CEO Nicole Coburn.
So we are here today because on April 29th, our office presented the proposed budget and asked the CEO to look at restorations in a variety of areas. Again, on June 3rd, during HSA's budget hearing, the board directed the CEO to add some additional programs and services to the restoration options that we're presenting today. And so I'm going to review those with you. So in terms of laboratory services, we're recommending an extension, a 90-day extension that would allow for the agency to establish the streamlined referral process within the community. This would continue laboratory operations until September 30th, 2025 at a cost of about almost $81,000. We also recognize that MHCAN, as you've heard throughout the budget hearings, provides an important service in Santa Cruz. Due to this, we reached out to the city manager of the city of Santa Cruz. Initially, there was thinking that they were going to have to conduct a thorough review of their homeless services programming and funding. As of this week, he reached back out and said that they would be able to agree to a $100,000 contribution. This is because the HOPES program is going to be ending at this fiscal year due to the implementation and launch of our 24/7, 365 mobile crisis response program. So because the city of Santa Cruz helps to fund that program, their allocation to that program, 100,000 of it will be shifting from HOPES to MHCAN based on our conversation. Because of that, we're recommending that the MHCAN contract be restored at a cost of almost $478,000. And this was the revised request that was submitted in coordination with MHCAN. Next, in terms of Gemma House, we've been working with HSA regarding the Gemma House and a transition. We are pleased to tell the board and the community that we are recommending Gemma House transition from New Life Community Service to Janus of Santa Cruz. Janus has an existing contract with the Health Services Agency in relationship to the Prop 47 funding. They operate a number of recovery residences for the county with that Prop 47 funding. So we are recommending that Janus operate Gemma House under this alternate model in terms of a recovery residence, which would still serve the same population of women reentering the community. This would be cost neutral to the general fund. I will add that in May, the Santa Cruz County Community Corrections Partnership approved the use of up to $150,000 in our AB 109 treatment and intervention services funding to help support the Gemma House. This one-time funding may be needed for some deferred maintenance or one-time startup costs. Our staff did walk through the Gemma House last Thursday. They found that the house was generally in very good shape. So we'll be working and coordinating with HSA and probation to determine if we need to use any of that $150,000 on any of the deferred maintenance or startup needs. We'll continue to partner with HSA to ensure a smooth transition. The remaining 2 women who are living at the Gemma House are being transitioned to other living arrangements. And HSA is going to modify its fiscal year 2025-26 contract with Janus, to incorporate the Gemma House as another recovery residence. According to our conversations with Janus and the Janus CEO, they are hoping to have a grand reopening over the summer, which I'm sure they'll invite you to. The next restoration that we were asked to look at is the syringe litter cleanup services. We are recommending the restoration of the CAB contract for syringe litter cleanup in South County at a cost of $40,000. The city of Santa Cruz has indicated a willingness to modify its downtown streets contracts, which serve the city of Santa Cruz. They would modify the schedule to ensure syringe litter cleanup, both downtown and at the Emmeline campus. And hopefully we'll receive an update on that soon. Lastly, at the budget hearing you had last week with HSA, you had asked us to look at restoring integrated behavioral health services at the Freedom Campus Health Center. We took a look at that, and we're recommending to restore one full-time equivalent senior mental health client specialist 1 position and 0.75 FTEs of psychiatrists on the locum tenens contracts. All of these positions are revenue generating. We've had some challenges with recruiting, but assuming we can recruit into the position and reestablish the contracts, we believe that we will be able to draw down Medi-Cal reimbursement and cover the full cost, which is about $347,000 for the psychiatrists and almost $47,000 for the full-time position. So with that, the restorations would cost almost $1.4 million. And next, I'm going to turn to how we would fund these restorations. First, as you know, we have very limited places to go in terms of figuring out how to fund these services and programs without requiring a cut to departments in the county. We have identified general fund contribution that we could move in order to facilitate these restorations. First, we are recommending that some of the restorations be funded by reallocating the general fund contribution of $500,000 for the Capitola Road culvert repair. This project is part of the Zone 5 Drainage District, which services the areas of Live Oak and the city of Capitola. As you know, the Zone 5 residents pay property taxes and development fees on new construction to fund stormwater drainage services in Zone 5. There is a fund balance currently of almost $4.3 million in Zone 5, but we have several projects that your board is aware of that we're entering into in this next fiscal year. Additionally, due to the capital improvement needs of deferred maintenance in Zone 5 and based on the Zone 5 master plan, we are anticipating requesting increased residence assessments in winter or spring of 2026. Both due to the fund balance and the upcoming election, we believe the general fund contribution of $500,000 for the repair project can be used on the HSA budget restorations while we pursue an assessment revenue increase on the project. Similar to other new projects in Zone 5, CDI anticipates working on design and environmental work on the projects in this next fiscal year. And then construction on specifically the Capitola Road project would be completed in a subsequent budget. So in addition to this general fund contribution, we also took a look at our general fund contingencies, and we are recommending a reallocation of district sales tax. Initially, we thought this reallocation was going to be higher. It was more around above $300,000, but due to the city of Santa Cruz's reallocation of the $100,000 and some MAW revenue, which is Medi-Cal Administrative Activities revenue for MHCAN, that has lowered this reallocation of Measure K housing-related funding. This Measure K housing-related funding would normally be used on county and unincorporated area general or county unincorporated area housing uses. We would instead, by this reallocation, take that Measure K housing funding, use it on general purposes in the unincorporated area, thus freeing up general fund contribution for these other services. So it's a little bit of moving money around. Then in terms of other funding, MHCAN and the restoration of that contract would be supported by the general fund contribution, as well as that City of Santa Cruz funding I mentioned of $100,000 and the MAW funding. Finally, Medi-Cal reimbursement revenue would cover the entire cost of those behavioral health services at the Freedom Campus Health Service, and that's almost $500,000. In total, that comes to almost $1.4 million, covering the entire restoration. There are a variety of services that we're not recommending for restoration. The first is the radiology services are recommended to fully transition. The HSA is working on providing that streamlined referral process to providers in the community, and we would recommend closing that on June 30th of 2025. We also do not recommend restoring the suicide prevention coordinator. This position is funded by a CDPH grant that ends on August 31st of 2025. The suicide prevention plan, we will note, is going to remain in place, and aspects of the plan are going to be worked on both by behavioral health and public health. And then lastly, the Downtown Outreach Worker Program, which you asked us to take a look at, we are not recommending the county restore this contract. CalAIM does not reimburse for these outreach activities, and the city of Santa Cruz has told us that they will fund and manage the contract on their own. And so the contract would continue within the city of Santa Cruz. So with that, our recommended actions are to approve the HSA proposed budget, also to approve the CEO's budget restoration recommendations and our funding source recommendations. And then, of course, along with these recommendations, everything we're recommending, as well as any other direction we receive today, will be incorporated in the fiscal year 2025-26 budget. We're happy to answer your questions.
Thank you. We'll open it up to the public for public comment. See if there's anyone that wishes to address us on this item. You have 2 minutes.
Hi, board. I didn't get my 1 minute, but I will make contact to your staff. I want to say thank you. I am on the board of, thanks to you, we're not closing down MH-CAN. But what we are going to do is empower those that are homeless to be part of changing that one neighborhood. And particularly, you know, Felipe, veterans don't live in the sky. We'd like your help, as you have given us. And so this is one county where you know I'm not going to go away. And right now, that's good news. And I think we can take people who are served there, get them involved to be your partners as supervisors, not just there, but all the way to Watsonville. You who know me know I'm never going to give up. Please don't have me be called by St. Peter. If so, if I've done right, Vets for Vets, what a brand. See what you can do to move that forward, and we'll bring it to Watsonville. Over and out. Thank you, thank you, thank you.
Good afternoon, Board of Supervisors. My name's Serge Cagno, present member of the Human Services Advisory Work Group and past member of the Mental Health Advisory Board. I'm the director of Stepping Up Santa Cruz. We do CalAIM case management for those on Medi-Cal experiencing homelessness and those with significant mental health challenges. I come before you to in support of funding MH-CAN for the staff's recommendation. As you know, MH-CAN provides services to many clients who are minimally connected to any other service provider in the community. MH-CAN is a place of safety, support, advocacy, classes, computers, showers, clothes, and food. Stepping Up Santa Cruz and MH-CAN are creating a partnership to provide case management for the medical needs and housing needs of MH-CAN members. In the short term, I ask you to continue to fund MH-CAN. I also ask you to request the City of Santa Cruz to modify their special use permit for their requirement of private security, which is part of what the cost is, unnecessary cost on their contract, to either remove the private security requirement because they haven't had any incidents in the last few years, or to allow a MH-CAN staff or volunteer to support that role. The other permit limitations, I would also ask the city for you to request the City of Santa Cruz look at modifying the daily limit on members and the limit on serving food to members. In the long term, I would ask you to support MH-CAN and other small nonprofits who may have county funded cut or limited, and the state funding and the federal funding that's being cut and limited, to have county staff assist nonprofits in finding other sources of funding. There are a lot of nonprofits that are very small and very inexperienced on finding grants. And if there's staff that find different kinds of grants, to letting them know, we're going to be cutting your contract. We can help you. We can write a letter of support. We can sign off on your grant application. That would really be a large assistance to the nonprofits. Again, I ask for your support for MHCAN. Thanks for your time.
Good afternoon, Board Chair Hernandez and board members. My name is Betsy Clark, and I live in the city of Santa Cruz. And I came here today to express my shock and my deep concern for the closing of the Telos Crisis Residential Program. Also, I came here ready to say the same about Pacific, but I understand that that has been restored, and I'm very grateful for that. Very grateful. As you may know, this will be a loss of 10 beds for step down from locked care or for avoidance of locked care. This will create chaos and worse for families dealing with people in the hospital or trying to avoid the hospital or the locked care. And I think that this is an incredibly ineffective way to save money because of the effect on the entire system. I think everyone will agree that we already have a shortage of beds, of crisis beds and transitional beds. And so in this system, this will back up the system and exacerbate the financial situation greatly because people will stay longer in locked care or go out of town at additional cost. Also, there are criminal justice initiatives that utilize these beds and apparently fairly well to reduce their time in incarceration or avoid it. I have worked closely with County Behavioral Health over 30 years, and now as a board member of NAMI and a helpline volunteer for NAMI, I stay connected as an advocate and supporter of the people served by behavioral health. I just have to say, I am surprised and dismayed at the suddenness of these decisions, or this decision, I guess I was adding Casapi, and the narrative that's being spread that the county abruptly defunded these services as part of these budget cuts. If you notice, they're not in the budget cuts.
Thank you.
How did this happen?
Yeah, good afternoon. My name is James Ewing Whitman. You know, I'm honestly not sure what the overall budget with the county is. I know a couple of years ago it was 1.3 million. From what I saw, the two screenshots, you guys are looking at restoring about $4 million to services that were cut. My understanding is the revenue is 289 million and you guys are expecting to spend 330. That's at least 25% of this budget. What I find interesting is when you go outside and you look at the binders, there's three. Two of the binders have almost 2,900 pages, but this item, which is at a minimum of 1/4 of the budget, is less than 30 pages. I think that's kind of odd. Oh, good. That was the nice part. So what's happened here over the past 6 years with the health? You know, where's the accountability? What is going on? You know, how many people have been harmed by these closures that were supposedly put forth by some kind of logical medical standards? And really, what's next? Where is the accountability? And I'll give you an example of accountability. I left here this morning. I went to the city. Once again, for whatever reason, the person in charge, Mr. Keeley, forgot about people being able to make public comments on the consent agenda item, and I made the mistake of going. That wasn't the ideal thing to do. So it led to some funny dialogue. He took me aside during a break and we had a good conversation. Hey, call a point of order. Then he spent 3 or 4 minutes talking about that actual practice. And I left that to come here on time to find out something was going on. And I called a point of order because I was confused at the paperwork. And I don't think anybody would really be happy with the head attorney, Mr. Jason Heath, the way he handled that. At least there's a paper trail and a trail of that. So we are all in this together. I'm only here because I actually care. I don't want to be always critical, but we can all do better. I'll start with myself. Thank you.
Good afternoon. My name is Dr. Neil Richmond. I'm an orthopedic surgeon. I've been working for Santa Cruz County HSA since 2011. I want to tell you 3 things in less than 2 minutes. Number 1, eliminating radiology services at the 2 health centers will have a negative effect on patient care and patient outcomes. Number 2, it will likely result in an overall increased cost to county through increased utilization of other services. Number 3, I have a proposal to maintain critical X-ray services and reduce costs at the same time. Number 1, patient care and outcomes. The 2 HSA health centers receive direct and indirect referrals from the 2 Santa Cruz County Hospital emergency rooms on a regular basis for patients with acute musculoskeletal injuries such as fractures and dislocations. Any comparison to other FQHCs, which either do not have orthopedic surgery services or do not receive these same type of acute injury referrals, is comparing apples with oranges. These type of injuries are time sensitive. They require timely assessment and treatment in order to have the best chance for good outcomes. A delay in assessment and treatment can result in a requirement for more complex treatments with more risk, both which reduce the chance for a good outcome that would have otherwise occurred with timely treatment. Eliminating and outsourcing the X-ray services introduces delay, and I just told you how that can compromise outcomes. Number 2, delaying treatment can also increase costs downstreams. Complex treatments are more expensive, are associated with prolonged recovery, increased utilization of rehabilitation services and medical devices, along with increased utilization of in-home care and transportation services, etc. Number 3, compromise solution. My proposal is to reduce X-ray services to 2 days a week to coincide with orthopedic clinic schedule. Other clinic providers can order X-rays to be performed on these days. This new schedule can help make X-ray utilization more efficient, moving towards a more revenue-neutral operation. It represents a 60% reduction instead of 100% elimination.
Thank you.
Hi, board. Liam McLaughlin with SKU 521. First, I just want to thank you guys for your questions and comments at the hearing earlier today. I think they were really instructive. I'm asking you to not shut down the lab and radiology services. I think you guys had put a directive to personnel to come up with alternatives, and from the hearing this morning, it sounds like they failed to do that. And I think this is, it's been a 50-year-old highly successful program that Santa Cruz has that should be proud of and should stand behind. And let's not vote that away without having really done all of our due diligence that you guys asked the personnel to do. So thank you.
Hello, my name is Nick Bodsky. I've worked and lived in Santa Cruz County since 2012. I'm here to just voice my strong support of MHCAN. My journey with MHCAN began after I was discharged from a psychiatric hold and was placed in Telos, where I was to remain there for 2 weeks and recover before returning home. During my stay there, MHCAN came and stopped by and did a few groups with me. The folks that joined us were called shadow speakers, and they were really people who did peer support. They didn't just talk, they shared their stories, which I found to be very impactful in my recovery. They talked about mental health struggles, addiction, recovery, loss, and hope. They told us that we are welcome to come to MHCAN at any time. If you want to have groups, if you want to have coffee, food, or just someone to talk to. I was in awe after that visit. Their stories didn't just inspire me, it gave me hope. For the first time, I realized I wasn't alone. I saw a future where I could give back to the community too. Maybe even share my own story one day to help others. Before that day, I've never heard of the term peer support, but in that moment, I felt it and it changed my life. MHCAN has been a profoundly positive force in my life. I truly believe I wouldn't be where I am today without that first introduction at Telos. And this is just one story, right? I often wonder how many others in the community have had a similar experience and how many lives have changed because MHCAN was there at the right moment. Thank you for your time.
Hello, I'm Alice Morrison. I've been a longtime resident of Santa Cruz County. I'm also here to speak in support of MHCAN. And I'd like to just point out that for every professional dollar that is spent on MHCAN, untold amounts of community effort and mutual aid and mutual support are leveraged as well. There's no way to measure the amount of additional support and additional aid that people are willing and able to bring when they have a place to bring it and a framework with which to utilize it. So for every dollar that's spent there, we have no idea how much more the community is bringing forth to help one another. It's a format that's being emulated all over the country right now by people who are excited to reduce budgets while increasing mutual aid. And it would be a shame to waste it now by defunding it. So I understand there's further budget cuts in the making, but keep in mind, there's no better group to leverage $1 of official funding than hundreds of volunteers who are providing mutual aid. Thank you.
Hi, my name's Tamar, and I really appreciate that you managed to get funding for a lot of these services. Every bit of service that you save really matters. I guess I'd also like to say that I know that there's many people in the county jail experiencing mental health crises, and that we spend $10,000 to $15,000 per person per month on incarceration. And it would be great if down the road we could capture some of that funding for mental health facilities that might treat those people better. Thank you.
Bernie Gomez, yeah, kind of just echoing what the previous speaker said. I was just thinking about, you know, this county spends $49 million to operate its jails, you know, whether it's FTEs and all that stuff, right? Medical, food, all that stuff. So, but the first things that go on the chopping block, right? It's always the health services, you know, those things that are, that, you know, address the vulnerable community, you know, the folks that are struggling. So I'm just thinking about cuts and like all those things that are coming forward, you know, it's like there has to be a strong will to do something different. And going to Supervisor De Serpa's comment, a belt tightening, you know, like there has to be some like genuine hard conversations, you know, about who's in our jails. And how can a lot of the folks in the jails, right, are waiting for beds, you know, to go to get rehabilitation services, you know, and that's directly from the sheriff, you know, and for some of the research that we've done too. A lot of the people that are there also are struggling with homelessness and substance abuse, right? And it's more costly to just leave people in jail, right? And it's more cost effective to build that health infrastructure, right, where we don't end up in the situation that we are in today, where gracias to the staff, right, for doing their diligence and finding, you know, ways to support MHCAN and you know and others, right. But I think if we just kind of restructure a little bit, right, and you know, those are hard conversations that need to happen, but they need to happen, and that's just the reality of it, right? Because the needs in our community are not criminal anymore; now they're health related. You know, so with that being said, thank you.
Thank you again for funding, for being able to find this funding, but I think you're putting a lot of pressure on HSA and Health and Human Services to do that work of finding the money. And I just want to raise again this example at and with the dollar numbers. So, and this is state, but it's an example of what we can do locally. State of California has saved $620 million, and that's annual savings. It's not a one-time. Since 2021 by closing prison facilities.
So the prison, we've been able to do that at the state level because of declining population, and there's been no impact to public safety. Here in our county, we've also been seeing declining numbers in both youth and adult jails, and yet related budgets continue to actually increase, even adding new correctional staff. So I think it's just highlighting that, and the fact that it costs more. It costs more to incarcerate. And what we're doing is we're criminalizing mental health. We're criminalizing poverty, criminalizing homelessness. We know the numbers are outrageous. People who are homeless and with mental health issues in our jails. So we need to support MHCAN. Thank you. We need to support these preventative services, and we need to take people out of jails and put that money into these services. Thank you.
Thank you. Anyone online?
Yes, Chair. Jason, your microphone's now available.
Hello. Yes, this is Jason Johnston. I'm a physician assistant with the Homeless Persons Health Project and SIU 521 member. So I just wanted to point out that at 2 prior hearings, board members instructed HSA administration to produce alternatives to the closure of radiology and to the closure of laboratory services, and HSA administration did not give you alternatives. So I would propose that the board shelves these closures until we're given alternatives, and the board can make an informed decision. A good example of an alternative, we currently have revenue generating positions where hiring has been frozen by HSA administration. Revenue generating positions like the nurse practitioner or HVHB, we're currently not being allowed to hire, even though in past board communications, the admin says they make up to $2 million per year in Medi-Cal revenue for a for a clinician in the county clinic system. We have a severely impacted clinic in South County with new patient slots 4 to 5 months out, with the only FQHC in South County taking new adult patients for more than a year. If we were to add a single provider, we would fund lab and radiology services for the county of Santa Cruz by adding that position. For some reason, these proposals don't look at how to increase revenue. They only look at how to privatize and cut costs. And as a last point, I would say we are not just another FQHC. We're the county clinic system. We are the safety net to the safety net. We are the primary medical home for people who are homeless in the county of Santa Cruz, North and South County. We are the primary medical home for people with serious mental illness. We are the primary partner for communicable disease, for HIV, for tuberculosis, for syphilis, for countless other health problems. You're cutting the services most critical to the most highest need population in this county. Please consider this with more information at your next hearing.
Amber, your microphone's now available.
Good afternoon, Board of Supervisors members and others in the room. Just wanted to empathize with how difficult it is to
Amber, can you please resume your comments?
Can you hear me?
Yes, we can.
Okay. Just empathizing that it's extremely challenging to get creative about funding and look at programs and what the community needs. And just that Santa Cruz County is extremely innovative as it's related to other counties in the state. So thank you for that and continuing to be creative. Janice looks forward to supporting New Life with transitioning Gemma and maintaining the original intention of Gemma as the founders intended it for, and supporting women back into reentry into our community. We hope to, once we have a contract, do a ribbon cutting maybe in Recovery Month in September, and look forward to partnering with the CAO's office and the community and HSA and delivering outcome-based metrics and transparency to the community on how we're doing. So just wanted to say that, and if there's any questions, please feel free.
Heather, your microphone's now available.
Hi, my name is Heather Love. I'm a psychiatric nurse practitioner.
with the County of Santa Cruz for the past 4.5 years. I want to echo everything said by Jason Johnston. The elimination of vital programs and services coming so quickly without any engagement from the frontline staff that provides these services. A lot of how this is done comes across as very disingenuous, as we see that provider positions can fund themselves and more. Why are the positions being frozen? Why is the psychiatric mental health nurse practitioner position not open for the past 2 years, well before anyone was elected to the current presidency? I have a lot of questions of why it is so difficult for anyone to even, impossible for someone to submit an application to this position while we currently rely on locum tenens who are much more expensive to provide the same services. And I feel that it's being just accepted. I hear it's being said that these positions are hard to fill. I have a lot of questions. Who is recruiting for these positions? Who is making it so that even an interested person can't even submit an application by not even posting the position for 2 years? Why is it that revenue generating positions are not being recruited for, posted, open, and the lists aren't being released? I don't see any reason for that to be the case. As a taxpayer, as a resident, as a community member, as a provider, I'm very, very concerned about the issue there. Thank you.
We have no further speakers.
Thank you. I'll turn it back to the board and then turn it back over to the chair.
Yes, we'll bring it back to the board, see if anybody has any comments or questions. We'll start to my right. I was like to do that.
Thank you. Thank you. And thanks to, our staff and our leadership here for digging deep and finding alternatives to cutting some of these needed services. I do want to deeply thank you on behalf of myself, the community, many people out there. I do have a couple of questions. We have a brand new behavioral health director, Dr. Sandoval, and I see her sitting out there. So we're grateful to have her here with us. But I think, what has been identified in the past and recently is that there's not really a continuum of care for our behavioral health, people struggling with behavioral health issues in our community. So can I just hear out loud, like, I understand that we proposed a rate cut to some of these community groups, Encompass for Telos and Casa Pacifica. Can you just talk about Telos? I mean, it seems like all of a sudden it just closed with no warning. Could you talk a little bit about what happened? I'm guessing we had a contract with them for a long time. Was it not being monitored? Did we have any indication that it was at risk of closing?
Yes, I'll start with some comments, and then I'll invite Dr. Sandoval to come up with any additional comments. So in knowing that we were in a budget deficit for behavioral health, behavioral health had been working with all of their facilities who they contract with for room and board, including Encompass. They've had many discussions. On February 18th, we did provide written notice to all of our facilities, including Encompass, about the change in rates and the rationale behind that. We offered some listening sessions following that announcement. And then following that, Encompass shared with us that they would be closing Telos in May. But I'll invite Dr. Sandoval if there's any additional information to share.
Hi, good afternoon. So speaking to the issue of the Telos closure. So as you mentioned, Supervisor DeSerpa, I'm about a month in to the position here, what I can share with you is that within the second week that I started in the position, we received notice. So that was early May. We received notice from Encompass that they would be closing the facility, and it was pretty rapid, and we did not have any opportunity to work with them around any alternate solutions to the facility. I think that they were in a dire financial situation and just had to make some very rapid decisions. So we had no opportunity to address anything. What I can tell you is that when a similar circumstance started to roll out with Casa Pacific, we jumped very quickly, and I coordinated with our team and with the CEO at Encompass and said, let's try to figure this out. We need these beds. We need our community to be served. And we were able yesterday to come to an agreement to ensure that the facility will remain open and operational for this coming fiscal year. And we will use this fiscal year to continue to work with them as an organization to ensure that our community has beds. And as a department, we need to figure out how do we grow this continuum of care. There's a real discrepant amount of beds in our community between the substance use beds and our mental health beds. 26 beds we have now that we've been able to keep Casa Pacific open.
On the mental health side?
On the mental health side. And so I also think that it'd be helpful to share with you that there is an important distinction between the rate reimbursement. So what the behavioral health department worked very hard to evaluate was the residential room and board rate, and did some comparisons around other Northern California county room and board rate reimbursements, and found that on the low end in neighboring counties, there was a $45 a day rate, and on the high end, almost 75. And so, staff here decided, well, we want to make sure that we're able to be comparable and set a $75 day rate. But that's for the room and board rate only. That's in addition to the daily reimbursement rate for the mental health services, which is around $400 a day. So they are getting both options to bring in revenue to the facilities for the services as well as the room and board. So definitely work to do to grow the continuum of care. Absolutely.
Are there any benchmarks for a county of our size, population of people suffering from mental health that we're serving, and how many continuum of care beds there should be in a community?
So that is a really important question. Part of what I've been starting to dig into with the team is how do we do a much more robust assessment of comparables and really determine those things. What does our community actually need to have a comparable continuum? So I don't have the answers to those questions, but I will be working with the team and trying to decipher that and have a really robust assessment that in the coming months we'll be able to share with you.
Thank you. And I know that, for example, I personally have placed people in an assisted living, which then mental health provided a patch. So I know some of the recipients, clients who have mental health needs that are older and have controlled symptoms can often be placed in an assisted. So I'm wondering if we couldn't grow that idea to expand some of the beds in the other facilities, for example.
Yeah, there's I think a whole continuum of residential care needs. Of course, there's our crisis residential facilities, there's our social rehabilitation facilities, and then I think you're talking about facilities that are really about more once someone's stabilized, how do we really help them sustain that stabilization?
Exactly. Thank you very much for answering the questions. And then there have been, we've been getting, as a board, getting email about management positions, lots of management positions, and is management being asked to downsize or to cut any positions? And I'll let maybe health services speak to that. Thanks.
Yeah, so for this budget proposal, we did have cuts across the board, all staffing levels, which includes even our executive staff. We released one of our assistant director positions. So we saw that happen. Proportionally, of course, we have the largest representation from our SEIU staff. So proportionally, they, just by the numbers, they had the highest number of staffing that were proposed to be reduced in our budget. I'll turn it over to our Director of Admin, Jessica Randolph, for anything further.
I think you covered it all unless you have specific questions.
Do we have a percentage of the cuts?
We do have the percentages, so I can go ahead and read them. Just to know if you want that detail. So one was from the executive management, so that's about 8%. 65.60 FTEs were from SEIU, which equates to about 11%. 5 were for mid-managers, which is about a little over 5.45%. And then 1.80 FTE was from the UAPD physicians group, which is about 9.5%.
Thank you. And I think the last thing I would say is that, like the orthopedic surgeon talked about when he came up, I do think that cutting the 2 radiology positions is likely a mistake. And so if there was anything that we could do to save those positions today, I would vote for that. Delaying the care of people with severe or orthopedic injuries by having to send them somewhere and wait, and then who's reading it, and then we got to wait till it comes up on the system. I mean, that could take more than a day to get, or several days to get people served in the right way. And so I think being able to have quick reads of imaging in the clinics is really important for people's care. Thank you.
Thank you, Supervisor Cummings.
Yeah, I just want to start by thanking you all for the presentation. And I think, and also I just want to thank the public for their advocacy and for coming out. One of the most important programs for me to save was MHCAN, and I'm just glad that we're able to keep that moving because it has a lot of importance for, all the folks in our county, but in particular, a lot of folks in the 3rd district who, for many, this is like the only day services that we have for people who have mental health issues. And, it's not just for people who are unhoused, it's for people who are housed as well. And it provides a great service to a lot of folks in Santa Cruz. And so truly want to thank staff for working with the city, and then also want to thank the city. I received an email last night from the mayor saying that the city was going to contribute $100,000 to help support MHCAN. So that investment alone from the city just really signifies how important this program is, and that they're willing to invest along with the county. So it's not just the county investing in these types of services. I still struggle, and I do want to express my appreciation for at least the extension for the lab services. I do have a concern that we don't have a similar extension for radiology. It seems like, as we've been hearing over the past few meetings, there is some interest in the staff, in the line level staff being able to come back with some proposals and working with SEIU. And yeah, I think to Supervisor Surface point with the radiology just kind of ending at the end of the month, even if we had a little bit carryover to figure out what that transition in terms of service providers will be, but also having an opportunity for some of the workers to come back and present us with their ideas, I think would give us a little bit of a window of opportunity to hear another perspective and potential alternatives to what's being proposed. I know that there are going to be some cuts happening with some of the other positions and other services. But, I think that this is kind of the tip of the iceberg when we start thinking about this, because as we move into the fall, it's the message that we've been receiving from the feds is pretty clear that they're going to jam these awful budget proposals through. And if they make it through, then, the fall is going to be a much bleaker position. But I think that, if we can maintain at least a little bit more of radiology and what that might, and so maybe that's a question of like, if we were to maintain radiology through the same time period, like how much more would that cost?
For the same time period, I'll just need a moment to look that up. For the year, it's about 500,000. So,
right.
Jennifer, I have that number if you, okay.
That would be great.
Based on the estimates that HSA put together, a 3 months extension of radiology would be $129,896.
I think, in the grand scheme of things, I know it's not perfect, but, I do think that based on what we've heard, we're trying to reach some kind of compromise here and provide a little bit of extension. And I guess when would we know who the next provider is going to be and where those services will be located?
We have those agreements in place already. And I do want to reiterate what we stated earlier during the hearing, that around 63% of our radiology services are sent out, and we only do about 37% of radiology services, and it's only x-rays. So we do have a weekly average of combined, it's just over at the Emmeline and Watsonville Health Centers only, combined totals about 44 weekly average. So that's about 20 at each site. If you look at the daily average, we're looking around 4 per day. So if we are going to have an extension of radiology by 3 months, what we would be looking at is similar to what was discussed earlier is, it does give us more time to really think about their patient experience and see and engage with staff about, what are some other options we can look at. But certainly because of the way we're financed as a federally qualified health center with our PPS rate, we can't, when patients come into our door and they see their primary care provider, they get an X-ray, which is the best sort of intervention, right? To do it just all in one go. We only get one payment for the bundle of services that the patient provides. We can't bill separately for that X-ray service or that imaging service. So if we are going to look at an extension of radiology for 3 months, again, we would certainly look at how do we support our patients in a transition. We'd be working out a transition plan, but long term, it doesn't fit our business model as an FQHC to maintain this service. We'd have to be creating a completely different service in order to be financially feasible with maintaining radiology.
And just a question for Ms. Coburn about where we would come up with the money if we were going to extend the 129. Where would you recommend?
Yeah, I would recommend, because we got the additional money from the city of Santa Cruz and the MA revenue, that essentially dropped the Measure K reallocation by $128,000. So this 3-month extension is basically almost equal to that at almost $130,000. So we would probably just re-raise that reallocation of taking from the Measure K housing funding and doing that redirect with general fund.
Thank you. I think in terms of patient care and really trying to make sure there's a smooth transition, I think that would be a good investment for the board to consider. It's not perfect. I really want to see us not lose these positions, but just seeing where we're at and the difficult decisions the position we're in, it does provide the workers with a little bit more time if they want to bring forward a proposal. And it provides us a little bit more time with trying to make sure that there's continual patient care and making sure that as patients may be transitioning to other services that, they have some time, because not everybody may be going into to see the provider within the next 2 weeks. And so I think this would be a good proposal for a transition. And it sounds like there's funding for it. So I would like to see that included. But I do also want to make sure that I think it's really important that, regardless of the decision that's made today, that the people who are in these positions, that there's a meaningful attempt at making sure that they can, if there's other positions that are available, that they can move on to those positions at the same rate of pay. Like, we don't want to see people losing, going down in terms of their salaries. And so to the extent that we can make sure that workers going to be offered another position, I think that that's really important too, because one of the things I'm hearing is, we can't cover the cost. And so it seems like there needs to be an effort at redesigning that model. And, the cost recovery, if there's some flaws with it, let's work that out. But we should be trying to retain our workers to the greatest extent possible.
Thank you, Supervisor Cummings. I'd be supportive of something like that too. We'll move on to Supervisor Martinez.
Thank you for the presentation, and thank you for all of your hard work to try to restore some of the services. I agree with my colleagues that seeing MHCAN restored was very important to me as well. I just recognize that, when I talk about or think about that safety net that avoids folks, completely falling through the cracks, I see MHCAN as one of those. So I'm really glad to see that we were able to restore that. I also appreciate just kind of taking that chance and restoring the 2 behavioral health positions. I know that that's recruitment is a challenge, and the intent is that they'll bill Medi-Cal to reimburse for their costs. And I hope that works. I hope that if we see that be successful, that it's something that we can look at for further restoration of positions. I know it's often a balance of, bringing somebody on and then hoping that they cover their costs, but it's a worthwhile effort if we're able to prove that it works. When it gets to some of the harder conversations, the harder discussions around the lab and the radiology, the impact on our workforce, the impact on our patients and our community, it's we're really in a difficult spot. For years, our clinics have been bleeding out, right? We've been operating at a deficit and plugging the holes through general fund or through other sources. And there never is a good time to, you got to stop this and we have to right size. But if there was a time, in my opinion, it's now, because what's ahead is incredibly threatening to our ability to provide any of these services in the future. And for the folks who came up and talked about the value of our clinics, the hardest to serve, those experiencing homelessness, those with the most acute mental health challenges, the most acute physical health conditions, that's who comes to our clinic. And that clinic needs to be there even when the federal government reduces Medicaid eligibility or the state government reduces, our ability to bill for the folks who need our clinics. And so while the trade-off is hard because lab and radiology is so important to care, I think right now when I'm weighing the scale, I'm looking at like the most critical, essential services that will keep our community healthy and a clinic there for the next 2 to 4 years, given what's ahead. And so that's where I'm at. And that's what's putting me in a position of like reluctantly approving these reductions, because in my view, it's an attempt to preserve the clinic and the safety net for our most vulnerable for the next couple of years. I would also support any effort to do a smooth transition. So if that motion comes forward, I'd be supportive of that. And in that, I would love to see greater engagement and collaboration with the workforce and those who know our patients well, is to know like what's going to work for them. If there's a reduction in hours of lab or location of radiology, like how are we going to create a seamless transition? I think that our workforces are the best people to educate us about that. So I hope that they can be engaged. But it's our responsibility to make tough choices to preserve what we have. And that's the position I feel like I'm in today. So those are my comments. Thank you.
Thank you, Supervisor Koenig.
Thank you, Chair. I do want to continue this discussion a little bit about potential options for radiology. We heard from one of our employees who works closely on this issue that with the suggestion of offering radiology 2 days a week. Could you compare that option to this sort of idea of a 3-month ramp? And I mean, I understand it would be an ongoing cost, but on the other hand, we know radiology costs about $500,000, but generates $80,000. We know that if we schedule someone to come back on another day, then when they're there for their initial appointment, maybe some of those costs are billable. Or, maybe in some instances, an appointment where we think there's an issue could be scheduled on a day when we know radiology is open. Could you just walk through that option a little bit?
Yes. So currently our radiology has 2 staff in it, or 3 staff, 2 FTE total. There's not much more we can go to reduce that. So radiology technicians need to have a chief of radiologists to provide the supervision. That's just per certifications and licensures. So that cost, and the greatest cost to a radiology program, similar across the board, is salaries and staffing. And so what we're looking at is, I think it's approximately about $400,000 for staffing, but now with reduced hours, now with reduced services. So we would have to explore that with how the math actually works in terms of how many visits, just how it would work. But I go back to my other point of the way that we are financed with the prospective payment service. We just get the bundled rate. So even if we have patients coming in, and primarily the driver of people coming in is because they want to see a clinician, so we get that bundled rate. We don't get an additional funding for, the X-ray service.
Yep, I get it. I mean, yeah, totally. And of course, the difference though is that radiology, those same patients, they might be comfortable coming to Emmeline or the Freedom Campus, but now we're going to be sending them somewhere else, different part of town. So it's the situation is a little bit different on radiology, as far as I can tell, in terms of the potential impact to follow-up care. And so, that's what I'm curious. I mean, could we reduce it to one full-time person? Maybe that is in Watsonville one day and Emmeline another.
So you're describing having a person work both locations, but still work 40 hours, or you're having them reduce their hours? Yes,
there's a full-time 40-hour
one full-time
person
back and forth.
Yeah, and just reduce the number of days that we actually provide those services.
Right. Well, we could definitely run the numbers, especially if you do the extension for 3 months. That's something we could run those scenarios and see and work with staff, like you guys said, to engage with them and evaluate that potential or that possibility.
Okay, I appreciate that. One other question that's come up is, it was mentioned by a member of the public, was the fact that we haven't actually advertised our psychiatric nurse practitioner positions. And so I'm glad to see the restoration of the money for the locum tenens, psychiatrist, and the other mental health position. But one question that comes up in my mind is, well, are we at the same time eliminating a psychiatric nurse practitioner position that we never advertised, and that now we're going to kind of locked into funding a more expensive locum tenens psychiatrist rather than, a nurse practitioner who can do, much of the same work for less money?
I just want clarification, because you're saying psychiatric nurse practitioner. I thought wasn't a senior mental health client specialist what we added back in, so there might be confusion.
Exactly. I don't think that they are being added back in.
Oh, so you were thinking something else was being added back in.
I'm just curious. Well, first of all, did we ever advertise for that position? And second of all, by committing to locum tenens, but then eliminating for a locum tenens psychiatrist, but eliminating other positions, including a psychiatric nurse practitioner position, are we sort of locking ourselves into paying more for these services than we could if we maintained a psychiatric nurse practitioner position, actually posted that?
I would say we locked in. I think we could do both simultaneously. I mean, we are trying to reduce just the kind of the risk of the amount of FTEs that we have on the books due to our structural deficit. So we can continue to utilize the locums, and we could potentially add a position back in, or we had a lot of unfunded positions as well. But historically, we have not been successful in the recruitment and retention in those positions. I don't have the stats, unfortunately, of when we last filled them. We have a whole spreadsheet. I can get it for you, but I don't have it off the top of my head.
Yeah, I mean, the question is, this is not just when we last filled them, but when did we actually advertise for this, right? I mean, because we're hearing from someone who's doing the work, wondering when the position is going to be open. They're looking at it, not seeing it actually ever advertised, and now seeing it go away.
We work closely with personnel, human resources on recruitment efforts for our positions, and especially for our hard to recruit positions, such as, nurse practitioners and clinicians. And I do want to clarify that we don't have a hiring freeze. So we've been hiring. We've been judicious with our hiring, given our budget situation and the proposal that we're bringing forward. But we have not had a hiring freeze in HSA.
Okay. Finally, I want to touch on the funding for MHCAN, which I agree, it's an essential service, and I think the money that we put into the service comes back in spades. What I am, however, cautious about is where we're looking to get the funding, which is to basically remove it from the zone, from the Capitola Road culvert project, which at first sounded okay, fine to me, great, Zone 5 will backfill. The problem is, when I looked at it a little bit more, Zone 5 actually, first of all, it's a flood control district, and this is actually in many ways a bridge project. I mean, it's a very large culvert, but if that culvert washes out, which is under a road that moves 15,000 people a day, the effect will not be flooding and property damage, which is the purview of Zone 5. It will be the loss of a major arterial in our road network. And so this really is a road project and not a Zone 5 project. And moreover, Zone 5 has, I think $60 million in high priority or $60 million in total projects identified, about 22 to 40 million of which are high priority. And so that extra money that's in the Zone 5 budget is not like, oh yeah, sure, no, it's earmarked for some very important projects. And if we take this money away from the culvert project, it's just not going to happen. The other thing is, even if the Zone 5 money was there, I would be concerned about just continuing to defer maintenance and cut funding away from infrastructure. And so even if that $500,000 was available, I'd say, great, let's spend it on the next highest priority culvert or culverts in the county. Maybe there's something under Mount Herman Road or Freedom Boulevard. I mean, these are comparable roads, right? I mean, 15,000 people a day. We need to address these vital infrastructure projects because otherwise the floor falls out from under us. I mean, we're talking about like potentially a $5-10 million fix. And then where's that money going to come from, right? If the worst happens. So, I mean, I think we've I guess I'd pose the question.
Yeah,
to our assistant CAO, if there's other places you looked at getting the funding but are not recommending.
Yeah, well, I first want to note that in regards to Zone 5, it has a stable revenue base, and we're actually in discussions with Director Machado about potentially issuing bonds so that we can get more projects done. This is a stable revenue source. We could bond against this revenue stream and actually get more, accelerate projects. So that's one idea we have, particularly with the revenue increase that we want to go out to voters for in winter and spring of 2026. This could bring even more revenue in and a higher level of bonding. So that's one thing. And the other thing is for all of the high priority projects that Zone 5 is working on, they will all probably be in design and environmental, including Capitola Road in the next fiscal year. And so Director Machado could speak to which ones would go to construction, but a lot of them, if not all of them, would probably extend into the 26-27 fiscal year in terms of construction. So to have it complete in next fiscal year is probably not realistic anyway. And so we're just trying to figure out ways to maximize the funding we have. But in terms of other places to go within the county, we are already thinking through, reducing travel, looking at professional services, looking at extra help. There are ways we can go to reduce the county budget, but we're going to need a lot of those mechanisms in October when we come back to you. And so we probably will end up going and looking at all of these other places to reduce the county budget in multiple departments. But at this time, we're recommending taking the $500,000 for the Capitola Road.
All right. I mean, I see Director Machado in the audience. Could you comment on the timing of projects?
Good afternoon. Yeah, I can share a little insight there. So for that culvert, Nicole's correct. We're in design. We're going through environmental process. It does take time. I think that, the best time of year to bid these projects out is wintertime. So clearly that's the target, but that's not a for sure. So there could be some situations where it wouldn't be ready for next spring construction. So it could slip into the next fiscal year. I think that's a real possibility. But in general, we try to do design projects in the summer, fall, so that we can bid them in the winter so that we can start the next spring or summer. But that gets real close to the next fiscal year. So I think that's a fair statement. And I think it's a fair plan going forward to look at Capitola Road culvert for future budget cycle for construction. So I do think that's a reasonable approach today for sure.
Okay.
Thank you. Well, thank you for the presentation. I also appreciate some of the things that were restored, like the mental health specialist, the local attendant, psychiatrist. Hopefully we can find those positions as well. And just like my colleague, Supervisor Cummings, I think labs in radiology are still the concern. Although one of the things that I'm concerned about is the radiology and kind of the service that they'll be able to get somewhere else, like at, I don't know, Watson Community Hospital. But assuring that they have, the patients have the same level of care and timeliness, I guess, because the 2-day a week kind of thing also, it's concerning because it's, we fall back into the same issue as like, well, they're not there one day. What if the patients are there, but there's no x-rays or, that they can do that day, and they fall back into the when are they going to come back issue, if that patient returns. But there's no best answer, I don't think, whether it's the 2-day or the extension. The extension does give us time to look into these things. But again, I think the most important thing is that smooth transition and making sure that whatever happens after September, November, that we have a good transition in terms of the level of care. That we have language in these MOUs that we have with either the hospital or with Watson Community Hospital or whoever might be doing the X-rays. I think one of the other things I'd like to see is to make sure that we have a follow-up at our next meeting with sort of an update with the 11 employees, 10.6 employees, that we have an update with what's going on. What have we done to, help them in this process? But other than that, I'll bring it up to the board.
So I'm going to move the recommended actions with the addition that we extend radiology services by 3 months in an amount not to exceed $129,000 in return with alternative recommendations prior to the second meeting in September.
I'll second it. Can we get an update with the 11 employees?
Yes.
Okay.
And that the intention there is that there's been some expression from the board to have staff kind of work with, or have the directors and kind of upper staff work with some of the line staff to see if there's some options that maybe we can consider prior to that, the September 30th closure date. And if there are, if we can have a discussion prior to then, I think it'd be really helpful. If we're going to continue, it may be that we can't find something, we're going to continue on the path that we're currently on. But I think just being able to, especially since the workers have come out and said, we'd like to have a conversation, we'd like to make some proposals, providing that opportunity, I think is just helpful in respect to them as we're moving through this process so that we have taken everything into consideration as possible.
Okay, you got second motion second. So we have we have a motion from Supervisor Cummings, second from Hernandez. We can take a roll call vote.
Supervisor Koenig.
Aye.
Martinez.
Aye.
Cummings.
Aye.
DeSerpa.
Aye.
And Hernandez.
Aye. Motion passes unanimously. Next, we have item number 8. Consider report with additional information on Measure A, road operation spending by district and 2017 to 2023 storm disaster spending. Approve the proposed 2025-2026 budget for community development and infrastructure, including any supplemental materials. Take all related actions outlined by reference by budget documents. Turn it over to Matt Machado, Director of CDI.
All right. Good afternoon, Chair Hernandez, fellow supervisors. Let me just get my stuff together here. Please. Okay. So as you introduced the item, last week I did present our CDI proposed and supplemental budget. And your board provided some additional direction that you wanted to see more information on the Measure K spending and road operations. Your direction asked to see the proposed equity of how this money was planned to be spent. And so today I'll provide that analysis. Additionally, your board asked for a disaster action plan that would result in a more resilient roadway network from major storm disasters. And so today I'll provide this information as well. I also want to quickly go over our budget again, just considering that I'm asking you to approve our entire budget today. So I'll recover a little, I'll present some of the same information I did last week. So as you know, community development infrastructure is a combination of planning and public works. Our primary function is to really develop land use policy so we could build a built environment to serve our community, both from building permit services, sanitation, solid waste, and transportation. Our department mission is focused on attainable housing, reliable transportation, and a sustainable environment. And so just quickly, just so we can recap where we left off last week. So our combined department budget is here, and I just want to make a couple of points. The overall budget is down a bit due to a few factors. And one of those is that we've completed a lot of large projects. We're also seeing some reduced state and federal housing funds, and we're projecting a more uncertain economy. So we're projecting some lower numbers to result in an overall lower budget. Additionally, on this slide, you can see that part of this proposed budget is 4.1 million of Measure K. And this is to provide services in the unincorporated area for both planning and public works. Half of that is in the planning side, the other half is in the public works side, which we'll talk in great detail today on. And then lastly, there's a summary of our proposed staffing changes with 2 additional staff proposed in planning as building techs and 6 additional staff in public works, solid waste division, so that we can transition our recycling program into in-house services. So here's delving into just the public works side of our budget. And so, so you can see that the lower budget is really driven by the completion of some very large projects in nearly all divisions in sanitation and in transportation. And then a part of this proposed budget includes a general fund contribution of 1.98 million. And then, of course, the district sales tax contribution from Measure K of 2.1 million. Most of the general fund investment, about 3.9, is for road and drainage infrastructure, and that's what we'll go into next. And this is obviously a significant investment, and so we'll spend some time on it. And then, of course, I already mentioned the change in staffing. Okay, getting back to where we pretty much left off last week. And so I would like to put your attention toward the the proposed $2 million spend of Measure K into that first line item, the road operations increase in services. I'll just start by saying that roads serve everyone really equally. It's our goal to use limited resources to keep the entire system open and operational to serve our entire population. And so today I'll just really delve into how that $2 million is being proposed to being spent. I'm going to start by doing a breakdown of that work type in that road operations, which is something I described verbally last week. And I have shared some of this information with some of you in the past. And really what it is it's a breakdown by percentage for each work area. And so I do want to direct your attention to we've broken down the 4 areas of road operations proposed, which include ditching, striping, paving, and culvert repair and replacement. And we had originally broke this down by percentage of the total work proposed across the county, so by district. And I do want to point out, if you look at under ditching, and then you line up with District 4, 1% of ditching in District 4, and you might ask why. Well, there's good reasons for all this. The reason for the less ditching in District 4 is they have less ditches to maintain. Much of the roads in District 4 are fronted by ag operations, and those ag operations in general maintain those ditches for us. So there's less ditching to do. But my main point here is that we believe that this proposal does provide good geographic equity across the county. And so you can see in the far right column how we're dividing up the work by percentages of the total work by district. And so you can see there's pretty good geographic equity, but that doesn't tell the whole story. And so the next slide will get into the cost of these services, because I know the board was interested in how we spend the money, not just where we do the work. And so on this slide, we've taken that same work, ditching, striping, paving, culvert repair, replacement, and we've assigned the cost to each of those services. And then we broke that down by districts again. And then so if you go to if you compare the third column, the population percentage by district, with the far right column, where we plan to spend the money for each of these areas of work, you can see that, again, we have good geographic equity when you compare where people live compared to where we're planning to spend the money. And so just a direct comparison of population base per district to proposed spend for each district, you can see the comparison. You can see it that way. And so next, I do want to, and by the way, this is still our proposed work plan for this given year. Our next slide, I'm going to take the same amount of work, but break it down into a little more detail per person. And so this is the core maintenance tasks by district again. The cost of each service broke down into that per person category. And this really gets to a point where I think we all can understand how we plan to spend that Measure K funding per district per person. And so if you look at the far right column, the cost per person is there listed. And I think it shows a good spend in each district, highest in 3 and 4. But that's just how the numbers worked out with the population based upon the work demand for those areas. And so again, this is our proposed recommendation for the proposed budget, but your board to ask for a change to this, or at least an alternative to consider. And so that alternative was to look at the $2 million broke down equally in dollars by district. And so that would be $400,000 per district. And so if you look at this next slide, just assigning the dollars per district equally, it would result in a pretty dramatic uptick in dollars spent per person in districts 3 and 4. You can see those numbers on the far right. And so we are not recommending this alternative, but we did want to bring it to your board for discussion and consideration, because it is directly what you'd asked. And so now next, the next slide, I'm going to shift gears a little bit on you. The next slide is really an analysis that's responsive to both of your directives from last week, showing where resources were spent for the 2017 and the 2023 storm disasters, and also leading into a plan and a discussion of how to be more resilient for future storm disasters. So that was the second part of your ask last week. And so here we go, looking at some of these numbers. I know this slide is a little bit busy, so I really want to just direct your attention to a couple areas. So the top box is the 2023 disaster, and you can see what we've actually spent, what's remaining to be spent, the total event cost once we have it completely built, and then we broke it down again, dollars per person per district, just to get a sense of where the dollars were spent compared to where the people live. And you can see that those 1 through 5 districts, pretty good geographic equity, with District 5 being standout for 2023, which is understandable. These disasters aren't planned. We don't know where the disasters are going to happen. They just happen. And so I think we all understand that we're just here to respond to Mother Nature. And in 2023, Mother Nature hit the San Lorenzo Valley the hardest. And that's reflected in the dollars spent and the dollars to be spent in that dollar per person storm damage cost. And then 2017, just a little bit different. You can see there was a little different split, but again, 2017, we don't know where those disasters hit. They just hit where they do. And so we broke that one down to what we've spent, what we need to spend, and then per person per district. So the numbers are there broken down. And I do want to focus your attention on the column of estimated costs remaining to be spent. And this is important because your board asked for a disaster response plan. And so we still have about 76, almost $77 million to go to finish up the 2017 and 2023 disasters. As well as this conversation last week, there was quite a bit of conversation about how we spend our SB1 funds, which is a newer gas tax that was passed by the state in 2017. And the discussion was, where do we spend it? Well, most of it goes into storm damage response, but also it goes into major capital projects. It even goes into road operations to some degree. And so we put an analysis together to show you where we've spent those SB1 dollars over the past 3 years. And we tried to break it down by district. Again, the road operations wasn't easily broken down by district. And so you'll see on this next slide that we're able to break down most of the costs by district back into percentages based upon, the spend kind of per person. Again, with the variable being the road ops, which is countywide, about 11% of our SB1 dollars over the past 3 years. That 11% is like kind of on the right down at the bottom. That we believe was spent pretty equally across the county. And so if you were trying to assign a percentage, you'd probably take a couple percent and apply to each of the districts. And so again, even the SB1 spend over the past 3 years shows pretty good geographic equity as compared to where people live, the population base. And you can see those percentages on the third from the right totals. And so where that's going to lead us is next, I'll focus the next part of the answer to that disaster response into our emerging issues. And this was a part of our proposed budget, these narratives, but I do want to highlight a few things and probably just read them out so that we understand what a resilient transportation system looks like, feels like, based upon these emerging issues. So storm damage repair, we've talked a bit about that already today, but it's really the highest priority to be ready for the next storm, meaning complete those projects. The next highest priority would be our culvert repair and replacement. And then our third highest priority would be to continue to invest in our deteriorating pavement condition, because those three items, if we can continue to invest in those, will make us more resilient to future storms. It's clearly proven to be the best mitigation to having a resilient transportation system. And so I will describe each one of those individually so that you can get a sense of the magnitude of the challenge for each of these areas. So storm damage, we've talked about it. We have more than $75 million of repair to complete for just the 2017 and 2023 disasters. And clearly unrepaired sites are more susceptible to new storm damage. The next highest priority is our culvert rehab and replacement program. And this is right out of our budget narrative. But we did complete our first comprehensive inventory of roadway culverts. And we do have hundreds of culverts in poor condition that are in need of replacement today. And currently, we invest about $250,000 a year annually into these culverts, which mostly are small culverts that our road crews can make repairs on. And what's lacking is a larger investment. In our budget narrative, we do make the comment that a reasonable investment in a culvert rehab program would be about $1 million a year. And I think we actually talked about this already today, but I was going to use the example of Main Street. If we wait for things to fail, a couple $100,000 culvert becomes quite a few $1 million. And so there is value in starting a real culvert management program. And our estimate was to get us going to be about $1 million a year. The existing deferred maintenance on our culvert system is about $400 million. And then the third item, and this is where I'll leave you with today, is the deteriorating pavement condition. In 2018 was our last pavement condition assessment. It resulted in a PCI, pavement condition index, of 48. That's out of a score of 100. And at that time in 2018, we reported to the board that we would need $24 million annually to maintain that existing pavement condition index, and that we would need upwards of $49 million over 10 years to bring the entire road system up to a good standard. Currently, we've been averaging about a little over $5 million a year in resurfacing and improving our service condition. Most of that money is coming from Measure D, from grants, and also from local sources. We are expecting a new pavement condition this summer, and we will bring that report to your board later this summer. And then we believe that our deferred maintenance and pavement condition is about $300 million. And so that's our emergent issues. The recommended action today is to accept and file this new information on the Measure K spend by district and the 2017-2023 storm disaster spending, and also to approve the proposed budget for CDI with all the supplemental materials attached and the numbers as shown on the screen today. So I'll stop there and ask if you have any questions.
Thank you. First, I want to see if there's anyone in the public like to address us on this item. Anyone online?
I see no speakers online, Chair.
I'll bring it back to the board. Supervisor Koenig.
Thank you, Chair. Thank you, Director Machado, for the presentation. Just to be clear, didn't we just remove effectively $500,000 from the $4 million in general fund contributions?
Yeah, we did. That would be from the general fund contribution. That's correct.
Right.
Yes.
Right. Okay. And you mentioned Main Street, and just want to make sure that my colleagues are all familiar with that example. I mean, you're talking about the Bates Creek washout there. I was trying to, that was the example that came to my mind as well. It's sort of like, if we don't do it, what was the total cost of the Main Street repair or something?
I think it was right around 5 or 6 million, Steve. Do you remember? 5 million? 5 million. And yeah, no, I was going to add that, when that one collapsed, we had about 300 families trapped up there. And so we had to do some emergency repair on that one. That's not always the case. Sometimes we can leave roads closed, but in that case, we didn't have a choice. That's right.
Okay. That's all my questions. I believe that, like I said, this is the other looming issue. We've heard that we can do some belt tightening. I think that we should actually act on creating a $1 million culvert repair fund. We just removed $500,000 from the public works budget. I think we should restore that and add in another $500,000. And I think the easiest way to do that would be a reduction of 0.5%, 1% across all county departments, net county contributions for departments in order to then create that fund. So that's what I intend to move. Thanks.
Supervisor Martinez.
Thank you, Chair. Thank you, Director Machado, for the presentation. I appreciate you coming back to us with additional information. It's really helpful to see how the roads fund is distributed across the various districts. And it really does feel like it's pretty equitable. It balances out in different ways. But I like the different ways that you looked at it. And I am comfortable with the department's proposed allocation formula for the additional $2 million in Measure K funding for road maintenance this year. As we think about investments for our road infrastructure, I really encourage the board to look, holistically as far as what's the best investment in our entire county system and network, because we all travel on the same roads in many regards, and we all rely on the same roads in event of an emergency and for economic development and things like that. And I agree that we do have a pretty big structural challenge in our roads budget, as well as like the previous conversation we had in health. We have deferred maintenance of the tune of hundreds of millions of dollars, and I'm both looking forward to and dreading the pavement report, because I know it's going to just tell the picture that we all see every day, and we will be obligated to act on that and need to be prepared to act on that. heard a possible motion from my colleague Supervisor Koenig. Would you repeat the second part of that once again, where you would get the funding for a motion like that?
Yeah, so to reduce the net county contributions for all departments by 0.5% in order to generate a savings needed to cover or create about $1 million culvert repair fund. So, it's net county contributions from, really looking at everything except for this, apart from the sales tax is around, I think, $230 million. Some of those are like, AMBAG or the animal services, which we have contracts with and can't actually reduce. So this is kind of looking at everything else. And I mean, this again, just it gives us an opportunity to get this program rolling, to start thinking about it so that we're already moving if things should get worse.
So if I could comment, when the time's appropriate, I could comment on that.
Yeah.
So.
Yeah, maybe I'll just share my original reflection. Is that one, I appreciate the bold action from Supervisor Koenig. Again, I love your willingness to move something forward. I don't think I can support that motion just because I don't know the impact of how that will what that will change in all the other budgets that we approved already. In the previous hour, we spent an hour on, anywhere from like $300,000 to $500,000 and how that could change, critical services, and the 1% in some, or half of 1% in some budgets could, have a real significant impact. So without knowing that, I don't feel comfortable voting in that direction, but I do think it would be reasonable to ask for a plan to support a culvert repair program. What would it look like? Allow us to have that conversation, perhaps in the fall when we're looking at the greater picture and all the potential cuts, and just sort of lay it all out and be able to have some of those tough discussions. Because I'm not resistant to investing in culverts. I think we all recognize the importance. I just want to have all the information before I make any decisions.
Supervisor Serpa.
Thank you. Recently, I'm fairly certain we had some type of a discussion about a $50,000 allocation per supervisor district. And then I think Justin Cummings, you wanted to double that. Was that something that actually went through?
That was Measure K.
That was Measure
for Q. Sorry, Q. Yes.
Okay.
That was pulled from the consent agenda, and it's back on the agenda as item 10.1. 10.1.
Okay.
So you're still going to consider that.
But that isn't money we could use for culvert.
That's for parks,
plant, right? That's for parks and
resiliency,
isn't it? Flood.
It could be part of my interpretation. Maybe we should get the other staff, but my interpretation that it was part of a bigger project that involved wetland restoration and climate change adaptation. Yes, the culvert repair could be part of that.
Okay, thank you for the clarification. And thank you. That's a lot of data you brought forward. I was alarmed the last discussion we had about reallocation of the roads program. D1 has 28% of the mileage, 34% of the population. My district 2, 30% of the mileage and 30% of the population. D5, 24% of the mileage, 25% of the population. So in those 3 districts, we have 82% of the mileage and 89% of the population. And I know on the campaign trail, we all heard the number one complaint was that people were so upset and concerned about the condition of their road and infrastructure. So I do feel comfortable with the allocations as they've always been for the last 40 years. So I'd like to make a motion to approve the allocations brought forward as they always have been. I don't know if I
So
said
that would be
clearly enough.
recommended actions. It would be the recommended actions number 1 and 2 on the staff report.
Yes, thank you. Recommended actions 1 and 2 on the staff report.
Oh, okay.
I'll second for purpose of discussion.
You gonna add it on? Thank you. I'll be, what's that? Oh, did you talk? Oh, sorry. Supervisor Cummings.
First of all, I want to thank you for your responsiveness to the board and their interest in more information and kind of showing the differences in terms of how the funds are allocated. And I do get the concerns that some of my board members bring up. And then I also, think about the amount of work that went into getting these funds to be available in terms of moving Measure K forward and the efforts that my office and Supervisor Hernandez's office put into that, and many members of county staff, and knowing that there was not equal efforts in getting that passed. I think that's some of the concern that comes from our offices, because the amount of work that we put in was far more than many of the other offices put in, and then when we see proposals for roads to get fixed and we see less revenue coming towards our roads, that's the concern that gets brought up for us in terms of making sure that we're able to meet the road demands in our districts. And I know we just had one disaster on there too, because we didn't show, the impacts of roads from the CZU fires. We didn't see the impacts of the roads from 2024 storms. So there still could be more, obviously, information that could come forward that really shows how roads were impacted across different districts. Now, given that's being said, CZU fire obviously fell under a federal disaster declaration, so there's potential to recoup that the funding if FEMA still exists in the future. But there's ways to recoup that revenue that's been spent on trying to fix some of those disaster related road issues. I guess today I'm comfortable with moving forward with the staff recommendation. That might not be the way I'll want to proceed in the future. Just knowing that there are, some issues, there are some damages that have occurred in other parts of the county, and there are, more roads. I do hesitate when we just use population as a metric, because there are other people who are coming and visiting the different districts. I have more people coming to visit beaches than maybe some of the other districts. And so that has impacts on our roads. And so I just, using population, I guess it is an easy metric to use. But I also do have some concerns with the fact that there's a lot of other people who are moving around our districts for a lot of different reasons. And then, I think the one benefit from what we just took action on was that, the Zone 5 projects, like that's a funded district that has revenue coming in that can be used for these projects. And so when we're thinking about major cuts to programs that provide, significant benefits to people in our community, especially when we put forward, wanting to support mental and behavioral health as a value that we share. I think that's a big reason why we took that general fund contribution and use it to help save some of these programs that are really vital and critical at providing day services for people who are experiencing mental and behavioral health. So, I think that having a conversation moving forward about, funding streams for roads, whether we want to talk about a ballot measure or what have you, I think there are opportunities for us to have further conversations on how to fund roads. But I'm not comfortable with moving forward today and taking money from different departments when we just actually passed the budget for the majority of the departments in the county. So I'll support. Well, I'll hear from my other colleagues, but I'll second the motion made by Supervisor DeSerpa.
Thank you, Supervisor Cummings. So, I just want to begin by thanking our dedicated staff for all their hard work, getting us this additional detailed information. I know you guys are probably up all day doing that stuff. But it's important information for our road transportation and infrastructure needs. I think your efforts are critical, ensuring that we have a clear and accurate understanding of where our resources are most needed. As we move forward in discussing road and transportation infrastructure investments, including those funded by the general fund, sales tax measures such as Measure K, state and federal funds, it's critical that we do so with the commitment to fairness and equity, I think, moving forward. Every community in our county, whether urban, rural, unincorporated, deserves safe, reliable infrastructure and roads. So by continuing to work collaboratively and using the best agreed upon data to guide our decisions, we can ensure that every dollar is spent brings meaningful improvements to residents across the entire county. I do want to note that looking into the future, one of the things that would make me feel also better is that sort of an outlook, right? To look at the emergency road prioritization tool, sort of as a baseline to begin to look at the rest of the infrastructure needs. So again, I want to thank you, your staff, Matt Machado, Steve Wiesner, all the work that you guys do, and I will be supporting the motion.
Well, I'll offer a substitute motion, and then I would also like to give our CAO an opportunity to comment. The substitute motion is to move the recommended actions with the additional direction to reduce net county contributions for all departments, except the Health Services Agency, since as was pointed out, we did just have extensive discussions around trying to save $1 here and there on that, by 0.5% in order to generate the savings needed to create a $1 million culvert repair fund. And I would just briefly offer the comment, of course, it's difficult to suggest cuts to any department. Would never want to do that. This is, I mean, 0.5%, really just a belt tightening. And the situation to avoid here is having to go back and in the face of disaster and cut by 5%, 10%, because all of a sudden our liabilities have quadrupled because of lawsuits coming in, because people can't access their home, because we knew about the dangerous condition of roads for decades and didn't take action. I mean, this is a risk, and this is just one very small way to begin to address it. So with that, also, I mean, it's of course at the chair's discretion, but love to hear CAO Palacios's comments too.
Well, we need to get a second. We need first to get a second, if there is one.
Well, I'll offer some comments, I guess, if there's no second.
If there's no second, the motion dies. And right. Go back to the original motion.
Okay, we go back to the original motion, and I'll offer the comments regardless. So, I think that Supervisor Martinez had mentioned to just kind of prepare something that we have for our culverts for us to look at and, be part of those conversations. But also, I think that if there is any sort of restoration or habitat restoration that needs to be done along any culvert, that could be a different funding source through Measure Q in the future at some point. And I think that might offset that 0.5% at some point after several years, of course, obviously. But yeah.
Can I ask a point of order? So is the motion dead yet? Because I don't want to second the motion until I hear what
the substitute motion is dead.
It is.
And we're back to the original motion, which has been seconded.
Okay. And then
your motion seconded by Supervisor Cummings.
Okay, great. So can we hear from CEO Palacios?
In regards to the motion that died?
No, I think he had some comments on.
No,
a proposal.
Yeah, I was just wanted to make sure and add that at this point, I know when Public Works does their presentations, they traditionally show this unmet need that's in the billions of dollars. And of course we know there's need, right? Every time you drive around. But let me tell you, I conduct budget hearings with every department in this county, and they can provide equally convincing data about how underfunded they are. If you want to talk about behavioral health, we talked about how much we're cutting but if they talk about the unmet need in behavioral health, they can provide amazing data about how much we're not doing. Public defender, if you have the public defender up here and show you how much need is not being met with the budget she has today, it's going to be in the millions of dollars. The sheriff, the district attorney. I mean, we can get every department and they could provide, maybe I'll have them I'll do that because these guys like to do that. And I get it. They show this chart. Oh my God, we have $100 billion of need. And I get it. It's real. But we have needs across this county and they're very compelling needs. And I hear them and I say no to them. I tell the public defender no. I tell the sheriff no. And they all, because of the year we're in, they all basically withdrew their requests because we're in for a tough year. And so this was not the year to add new sheriff deputies, new public defenders, new district attorney, this was not the year and everybody withdrew. So I just want to make sure as we get, and we're having this discussion that we keep in mind all the other needs that we're funding as a county and all the other mandates we have too, because remember, we're mandated to provide public defender services. We're mandated to provide district attorney. We're mandated with the sheriff and they all have needs and they're struggling as well. So I just wanted to make that point that we keep the whole picture in view.
I mean, the question then becomes, are we mandated to provide road access to someone's property if they're paying us property taxes?
Well, I mean, there's a need for that too. There's absolutely a need for roads. And we spent $350 million in the last 7 years on roads. And we've incurred $91 million, not on behavioral health, on roads that we took debt on, And so anyway, I just make that point, but absolutely, I agree. It's a road. And that's why I put, the $4 million and $2 million in the budget this year for roads. And I was told that we were not going to impact the projects because part of the projects was this Capitola culvert and that we weren't going to impact it. It's still going to move forward as is.
Thank you. So as long as I was talking about future outlook, I think at some point we could even look at a future sales tax measure looking at behavioral health, roads, and maybe even a little bit for the public defender's office. But if there's no further comment, we'll take a roll call vote.
Supervisor Koenig. Martinez.
Aye.
Cummings.
Aye.
DeSerpa.
Aye.
Hernandez.
Aye. Motion passes with one dissenting vote from Supervisor Koenig. Next, we'll move to item number 9 on the agenda, hold a public hearing and adopt the resolution amending a united fee schedule for fiscal year 2025-2026. I'll turn it over to Marcus Pimentel, County Budget Manager, and Gina DeMartini-Coons, Senior Admin Analyst for the presentation.
Thank you. Good afternoon, Chair Hernandez and members of the board. My name is Gina DeMartini-Coons. I'm a Senior Administrative Analyst from the County Executive Office, and joining me today is Marcus Pimentel, the County Budget Manager. Twice each year, in June and December, the board adopts amendments to the Unified Fee Schedule. On February 25th, 2025, the board set a public hearing for today for the latest proposed amendments. There are revisions from the following departments: the Agricultural Commissioner, the Agricultural Commissioner, Auditor, Controller, Treasurer, Tax Collector, Cannabis Licensing Office, General Services Department, Assessor's Office, the Health Services Agency, Human Services Department, Information Services, Parks, Open Space and Cultural Services Department, Sanitation, District Community Development, and Stormwater Management Community Development, both of which are within the Community Infrastructure Department, Public Works Division, and the Sheriff Coroner. It is recommended that your board open the public hearing, hear protests and objections, if any, and if appropriate, adopt the resolution to revise the Unified Fee Schedule. Representatives from the department are available to answer any questions. Thank you, and this includes our staff presentation.
Thank you. I will now open this public hearing and see if there's anyone that wishes to speak to this item.
Thank you for the opportunity. My name is Tom Bros, and I just wanted to, I'm representing the Santa Cruz Farmers Market Association here today, and we're just in the same process of looking at our budget, and we're seeing that we have a lot of costs incurring right now with the transition of our downtown farmers market. And we've been looking at one permit that I think is duplicate and needs to be, we request that it be eliminated, and that's the event organizer permit right now. We have the farmers market permit that we pay for annually, and as well as the agricultural permit. But the event organizer permit that was added in 2019, and this board actually supported the farmers market and allowed a 50% discount on that one. But the fee has gone up, and it's really not adding any value as far as inspections, oversight. And we request that at this point, it be more consistent with what other counties do. And we just like to see that the event permit is eliminated from being applied to the Santa Cruz farmers market or any farmers market in this county. We've operated for 35 years, 5 farmers markets, and really an institution that provides food for the community and education, et cetera. And it's the event concept is really not applicable, we feel, to the farmers market. So with that, I feel if we could amend this or request this body to eliminate the event permit, that'd be great. Thank you.
Anyone online?
I see no speakers online, Chair.
I'll bring it back to the board. Supervisor Cummings.
Yeah, my office has been contacted a couple of years ago and then recently regarding the farmers market. And the one thing that I just want to touch base on is that, back in 2019, the Board of Supervisors, took action to help reduce the financial burden on farmers markets. Specifically, the resolution they passed back then amended the county's unified fee schedule to set the year-round special events organizers for the temporary food facility fee for certified farmers markets at $190. And although the board hasn't taken subsequent action to rescind that direction, environmental health has begun to apply both the certified farmers market fees and the special event temporary food facility fees to all farmers market locations. And as a result, these fees that are charged to the Santa Cruz Community Farmers Market Association have increased from around $1,900 per year to almost $8,000 per year. And so in trying to help support the farmers or the farmers market, I'd like to recommend that we adopt the recommended actions, but also apply the temporary food facilities annual fee only to the farmers market operators rather than charging for each individual market location. And so this would charge the association twice and for the operators, but rather than charging them for every single individual location where they operate at. And then also would like to recommend that should the board want to move in that direction, that environmental health works with the Farmers Market Association to come up with a reasonable fee schedule. When we look at some of the other jurisdictions, Santa Cruz is way out of market in terms of how much we charge. We charge way more than many other communities like San Luis Obispo and Monterey County. And I think having the staff work with the Farmers Market Association to come up with a reasonable fee schedule, I think would make a lot of sense. And so I'd move that we adopt the 25-26 unified fee schedule with the additional direction to apply the temporary food facilities annual fee only to farmers market operators rather than charging for each individual market location.
Second. If it's all right with the chair, yeah. I mean, I have looked into this issue a fair amount as well. And so like our environmental health staff do an audit basically that practices are being correctly followed at temporary food facilities. And what struck me as kind of not applicable or in the farmers market to be doing that twice a year with every location is that it's the same operator. They're setting up the same way in each location, following the same procedures, have much of the same staff. And so it really is sort of a redundant fee. And I think that our staff could work out a little bit more streamlined inspection schedule where rather than looking at every market twice a year, they could look at 2 out of the 5 markets every year, and you never know which one it's going to be. But ultimately, you're still getting to the same core issue, which is how is this operator operating, a market wherever it might be.
So, now that it's in discussion, I think my only kind of, I don't know, irk or issue is that if you're running 5 or 6 farmers market and paying one fee, it's kind of inequitable to the person that's only running one farmers market and is paying the same amount, but not as profitable because they don't have 5 operations. How would you address that?
Could I have staff come up and address that?
Yes.
Hello. Okay. So for the record, Interim Health Services Agency Director, Jen Herrera, and I will just actually turn it directly to our Environmental Health Director, Andy Strader, for these questions.
Yeah, good evening, Board. Andrew Strader, Director of Environmental Health. So I did want to clarify a few things. First of all, the model that we do utilize with the permitting for both the certified farmers market and the event organizer permit are prescribed by state law. And that is the normal or the majority way it's done in virtually every county. Monterey County does do slightly different scenario, although they do still kind of oversee both, although they actually technically do a lot of their inspections for the certified farmers market through their ag commissioner and not through their environmental health office. Our reviews with regards to other counties are that our fees are in line with generally speaking all the counties in the local area. I'll speak briefly about Monterey County because I know that one's a comparison that's brought up with this issue. The fee for Monterey County fiscal year 25-26 is, they do only charge one permit fee. It is $1,433. If you add our 2 permit fees that are in our proposal for 25-26, it comes to $1,490. That's only a $57 difference. So even a model like Monterey's that only has 1 permit, it's pretty much comparable, especially when you consider that their staff expenses are slightly below ours. It's statistically irrelevant. So I don't feel that our fees are out of whack, but it's very important to realize that these are 2 different distinct permits. And the reason why most counties do it the way that we do it, as opposed to the way Monterey County does it, is if there's a condition or circumstance where we need to suspend or revoke a permit, we would only be revoking it, that permit for that portion of the event that's in question, and as opposed to closing the entire thing down. So that's a more equitable and fair way of doing it, because otherwise you have to close the entire event down, both the CFM and the special event that's adjacent to it. Again, those are distinct permits under state law. We would still have to issue permits for both if we're following the law and do the inspections. Now the board is allowed to provide subsidy for any type of food business. The environmental health department feels that this particular situation is not maybe the best way to provide subsidies for the community. Yes, they're a nonprofit, but that's very similar to our same business model. We're a nonprofit as well. And it doesn't send the best message if we're going to subsidize or reduce a fee for these organizations in comparison to a lot of the other types of food businesses that we do have. Food business is a tough business to run. There's a high failure rate across all types of permits, and if we're to absorb that cost, basically it falls on the other permit holders to cover that. So if the board wishes to provide a subsidy, I would suggest something to cover those expenses, as we would have to continue with those expenses under the state law requirements. And I'm happy to answer or ask any other questions if you have.
Just if you could provide information on the amount of money, just so the board is aware, if the board were to subsidize, let's say, all farmers markets to be equal across the county, how much would it be?
Well, it depends on what you set the rate at. If we have 9 farmers markets, 5 are owned by the same organizations, Santa Cruz Community Farmers Markets, and the other 4 are independent. I was thinking that a couple of them also had dual ownership, but they just have similar names and they're not actually owned by the same organization. So 4 are individual markets, and 1 is owned by 5 are owned by 1. So if, for example, we set the fee at 50% like we did with the 2019 resolution for the event organizer permit fee. The event organizer permit fee is proposed at $549. So that's, roughly $225 or $275 if I do the math right. So you would have a savings of about $275 times 9, whatever that comes out to be. So yeah, we're not talking about a lot of money here. It's more of an objection based on principle.
So it'd be it'd be like $2,500 or something.
Just a quick question. So you're saying you cannot actually adjust the inspection schedule in line with the fee?
Well, I mean, each market is individual and each location is individual. So the organizer or the manager might be the same, but the CFM folks are different each time. And the CFM, Certified Farmers Market, I should say, is one umbrella permit over all of those certified farmers. So those certified farmers already in the state law receive a subsidy for 1 permit fee for however many, unlimited amount of farmers, certified farmers that they can have in their market. For example, downtown Santa Cruz, I think last I count, we had about 40 certified farmers participating there on our list. If we were to charge them individual permit fees for selling their produce like other produce vendors, it would probably amount to somewhere in around $20,000, give or take. So that's already a substantial subsidy. Chair.
Just a quick question. Do the fees cover the cost as is today?
I hope so, but I don't have the exact numbers for sure. So what happened was when we did the last fee study, of course, we had the pandemic, which did disrupt things. So we did the fee study based on the years prior to the pandemic. At that time, and this was the period just before the resolution in 2019, so it was 2017, 17, 18, and 19. It came out with a certain number, 202 minutes per location. But that data was a little bit off because the permitting for an event organizer did not start in 2019. It started probably 10 years earlier than that. And the Santa Cruz Community Farmers Market did not have a permit for that time. So we didn't have the ability to track time against that. So it was a little bit skewed. But when we came up with those numbers, 202 numbers, it did 202 minutes. It came out to, without any extra overhead fee, by the way, it came out to $750 roughly. We thought that was too high when we look at all the permit fees that we charge across all the different types of food facilities. That seemed unreasonable for this type of business. So we lowered that back down to 508, and that also matched with other types of event organizers that came in actually higher than them. We also lowered that down to 508. So we didn't even charge or set the permit fee at what the fee study indicated at that time. We'll plan on doing another fee study in a couple of years. We'll hopefully have better data because now we're back fully staffed. It's post-pandemic, et cetera. And we'll be happy to adjust the fees. Just like in 2022, some fees were lowered based on the fee study in certain categories and some were not. And that is in part to help balance and meet our obligations under Prop 26 so that basically people do receive services for the fees that they pay.
And when do you expect that fee study to be done?
Well, our goal is to do them approximately every 5 years. So we did one in advance of the 22-23 fiscal year. So what that 27-28 fiscal year, I guess, would be in advance of that.
So how will we, address those 4 independent farmers markets? Because it's 4 payments, because would they be able to get one applicant and all 4 just run the way they run and get one applicant to get subsidized? If we wanted to do that?
Well, yeah, for those 4, or if anyone new came on board, the proposal of not charging fees for extra means that a new market operator would have to open 2, and it's hard enough to open 1, but those 4 wouldn't get any benefit. If I was recommending to the board on a subsidy type of situation, I would say return to something along the lines of what was 2019, which was just a lower rate for all, because then it applies to everyone equally, and you don't have a favoritism or unfair business practice type situation created.
But it's still there, just at a lower rate, right?
Right.
Okay. Supervisor Cummings, you had a comment, question?
I did have one thing that I learned through this process was that this, special event permit for the temporary food facilities, like these are for people who are selling pre-made kind of food or food that they're making on site. And they already have to go and get a separate permit from the county in addition to paying to be able to operate at the farmer's market. And I think to your point around equity, I mean, if you were to operate that same booth at multiple farmers market sites, even under the same association, you'd be charged that fee at each of those different sites. So the idea here is being that they're already paying one permit fee. This is another permit fee that from the farmers market, and this is something that they've reached out to us about. It would really help them. And when we look at the grand scheme of things, $2,700 is not that big of that's not a whole lot of money in terms of the impact to the county. And so, my recommendation here is this is something in response to the community that we're hearing from the farmers market folks. The other part of this is to have staff working with them to come up with a better fee schedule. And, I think in the course of a year, when this comes back to us again at next year's budget, we'll be able to learn more and we'll be able to make adjustments that hopefully benefit both county staff and the farmers markets. But this is really, in response to the farmers market folks who see this as an opportunity for us to really provide them with support during a really challenging time.
I would just say, I guess from my perspective, I'm learning about this for the first time. This is new, and I didn't get a lot of information about this prior to today. And so it feels like there's an opportunity for a greater policy discussion and a decision about how our county proceeds with fees in an equitable way, rather than kind of a Band-Aid approach to fixing a single issue. So I would personally prefer to defer this conversation to a different place for, a policy approach towards event fees and these other licensing fees and whatnot. So that's my position. I appreciate the conversation, but without having more information, I don't feel like I can support a change that feels kind of specialized without a greater solution.
Just a motion. We can.
So you have a motion and a second.
Yes. Yeah.
And just to make sure we understand the motion.
Yes.
And if you could repeat it, what the motion was, and then that way we can make sure about the fiscal estimate as well.
Sure. So the motion would be to adopt the 2025-26 unified fee schedule with the following additional direction, which would be to apply the temporary food facility annual fee only to farmers market operators rather than charging for each individual market location, and direct staff to work with the farmers market associations to come up with a fee schedule that would be mutually agreed upon between the farmers market operators and county staff.
So is that, just want to make sure, is that workable? Can you, that direction, do you understand it? And can it, but how much would it cost?
And also if it's fair to the other four, or how can we make it fair?
If I understand correctly, that the proposal is if you own more than one farmer's market or operate more than one farmer's market and have a special event associated with it, then you'd only pay one fee for that, for those multiple special events. So those would only affect Santa Cruz Community Farmers Markets and their 5 locations. They would get 4 for free. And then the other 4 would not receive any benefit.
I would like to propose a substitute motion to adopt the recommended actions.
I would second. We do have that discussion sometime about how to, I think this is a whole separate agenda meeting almost to make it fair and more policy driven. But yeah. Supervisor Serpa?
I'm sorry.
I'm sorry. It sounded like you made a second, but then you added something to bring back a policy direction. I was going to ask, is that acceptable to the maker of the substitute motion?
Yes.
Okay. So now we have a substitute motion, a first and a second, and further discussion.
Okay, so my question is, when environmental health goes out to do inspections, like how often are they finding problems, non-compliance, health hazards, or health concerns?
In terms of certified farmers markets in general, well, I don't have any statistics for you. Generally speaking, probably not a lot of violations.
And how often are they inspecting in these locations?
Generally once or twice a year.
Is that by state mandate or is that sort of our own?
Yeah, there's no state mandate on the inspection frequency, per se.
All right, well, there's no further questions. Madam Clerk, roll call vote.
Chair, if I may just have the maker of the substitute motion restate the motion, as I believe there was additional direction given the substitute.
Oh. To come back with and for us to work on a more policy driven kind of a fee schedule for this.
Okay, thank you. That's correct.
Yeah.
I'll keep it simple.
Just to be totally clear, the motion is to adopt staff's recommendation, correct, with additional direction to come back to have a broader policy discussion regarding fees in general.
Yes.
Farmers market fees.
Yes.
Okay. Thank you.
Equitable farmers market fees. All right.
Supervisor Koenig.
No.
Supervisor Martinez.
Aye.
Cummings.
No.
DeSerpa.
No.
So for the record, we need to hear from Supervisor Hernandez.
I'm so sorry.
Forgot about me.
Supervisor Hernandez.
Motion fails 3-2 with Supervisors Martinez and Hernandez voting yes and the rest no.
So we revert to the original motion. The reason I voted no on the substitute motion was I do feel that what's proposed, having looked at this issue quite a bit and also hearing that we're not actually required to go to each farmer's market twice, location twice a year, I think actually is the best solution that I've heard. And so at least for the next year to be able to look at that, I think is reasonable. So call the question.
We need a second though.
I don't have any further. I'd share the same comments as Supervisor Koenig.
Oh.
So if we can,
this is the motion's already on the floor. It was made by Supervisor Cummings, seconded by me. Because there's substitute motions.
Okay.
And it's 5:30.
Got it.
It would be helpful to hear the original motion.
There's no motion on the floor right now. So somebody would make another motion.
It's the first motion.
that one
which
died.
was this was the first motion.
You got to make it
which was
again.
Supervisor Cummings, second by Koenig regarding, but it just applies to Santa Cruz farmers markets.
Oh, okay.
That doesn't apply to the other 4 farmers markets, the way you stated the motion.
no, to all farmers market operators. It should apply to everyone.
No, the only one with multiple owner is Santa Cruz. So that's why staff suggested if you want to make it equitable, you should just reduce the fee amount for everybody as opposed to just multiple locations. Because that only applies to Santa Cruz. They're the only one with the multiple locations. All the other ones are single owned.
And I hear that. I mean, there's economies of scale in every business. At the end of the day, I think we do want to inspect every operator. And so the whole point is there's an economy of scale here. The operator is setting up the same way in multiple locations. It doesn't preclude other operators from having multiple locations.
So those 4 can have one applicant, but to continue their operations? So they can get that subsidy, I'm saying?
So I guess for Justin, are you proposing that we just not charge any fees for event organizers at CFMs, period?
No, it's not the, as I mentioned previously, the additional directions apply to temporary food facilities annual fee only to farmers market operators rather than charging for each individual market location. And based on some of the conversations I've had, there is an operator who has 5 markets. There's another operator who has 2 markets. It sounds like there's 2 other operators out there. And I mean, the equity issue flips on both sides, right? Because it's like if the operator goes to multiple sites and is being charged, multiple times versus someone who's being charged just once, which ultimately goes on to the, the facilities, the people who have the facilities, then, there is the potential also for an individual who's operating a booth to get charged multiple times if they occur at multiple farmers markets under that umbrella. I mean, if the charge is going to be given to, if there's a charge for each site, then that means the operator, if they're going to be paying that charge at each site, then that charge is going to go down to the people who have those booths at those sites. And so, and I do just want to highlight that back in 2019, the board specifically took action to set the fees at 190, and there hasn't been any change in that since. And at the same time, those fees are now going up. And so what we're saying right now is let's just take a pause on the temporary facility food fees for this 1 year and move forward and have you all work with all the operators to figure out what would be an equitable way of charging these fees. So, I mean, that's, and I think that this is just an effort for us to be responsive to the people in the community and to provide direction with staff to start working with the farmers market operators so that we can come to consensus. And it's just 1 year. And again, it's $2,745. So that's a really small amount in terms of the impact to the county versus the potential for this to provide benefits for the farmers market operators. And I will say that, we've heard from multiple operators throughout the county, not just the one out of Santa Cruz. And so this is an opportunity for our board to be responsive to something that's coming up to us from the community.
Just to clarify, is the motion not to apply the temporary food facility permit to any farmers market, or is it to only apply it to the operator, not the location? What I heard was
operator.
The latter. Yeah.
The operator, not the location. Yeah.
So do you understand the motion? If you don't, then maybe you could just read it again and see if we can understand what it says.
I think I do. I think it just, like I said, I think it's going to mean that I think it means that markets that have multiple locations will only have one permit fee for the event organizer, which will benefit, from my understanding, one organizer.
And it does look like there's an operator who might be able to speak to this. If you might be able to approach the person mic, so if we can have them come to the mic. Because I'd like to see us move forward. I think
it is very confusing. I'm sorry. We're paying for every location. There's a farmers market permit fee that is applied since forever. I mean, we're paying $900 for the inspections, for administrative oversight, for everything. We do that under environmental health and for the ag permits. So that's how the county then sends their inspectors to each market and inspects our operation. Each vendor has a specific permit that they need to pull by ag or by environmental health on their own, even to be allowed to be at the farmers market. So they do that individually. But the Farmers Market Association pays a fee for each site every year. So $900 or whatever the fee is. So if we're in Felton or if we're downtown, each market pays one fee. So we're covering the inspections for those markets with that fee. We understand. Now the event organizer fee is a new fee that is not really, hasn't been defined. It doesn't really cover any of those inspections, administrative or enforcement kind of fees. It's the certified farmers market permit fee that covers that. And so we're feeling there's a duplication for the event organizer permit. And we're just asking if the event organizer permit can be removed. We're still paying, equitably and even increased those fees under the farmers market permit. And ag is separate, and we do that as well. So I just feel like it's just a duplicate permit where we're being charged too much.
And I do want to clarify that the permit is required by state law. And so what we are discussing here right now is whether are we subsidizing the permits for the additional operations under a single organizer. A way to think about this is, from an environmental health standpoint, is like a restaurant franchise. You have a restaurant owner or a business owner. They have an umbrella of restaurants, different locations. Each of those require their own permitting. Each of those require their own regulations. And so similar to that is this event permit fee, where you have regulations associated with each of those specific locations. Supervisor DeSerpa, you asked how many violations do we see? We certainly can come back to the board with that information. And hopefully we don't see much, and which is why we only go out there once or twice a year. It's really a preventative measure. Ideally, just the idea of knowing that someone's going to go out and be regulating, ensuring that clean forks are used for the samples, things like that nature, that helps create a system of trust in these markets. And so, and I will share too, again, the dollar amount is very minimal compared to what we've been talking about today. But there's a snowball effect. I mean, it's not just this that's uncompensated. There's the work that environmental health does. For example, the Moss Landing fire. Our environmental health team went out and did water lab samples, and all of that is uncompensated. So there becomes it becomes a snowball effect if we're not able to cover our costs based on the duties that we are required by law to do. Where we can recover our costs, we need to do that in order to make sure that we have capacity to do some of these unfunded things that happen, such as emergency response.
Otherwise, we'll end up like labs and X-ray, right?
No.
Supervisor Cummings.
And that's in part, again, this action is to be responsive to what we've heard from the farmers market. It reflects action that this board previously took in 2019. And we're also providing direction to have our staff working with the farmers and the farmers market operators so that we can come to some kind of consensus. And that was partly why I didn't want to get into all the details of trying to hash this out here on the spot. And rather than doing that, moving in a direction, again, that's aligned with what this board has previously took action on in 2019 and having staff work with the farmers markets so we could get to some mutual conclusion on how we want to move forward in the future. So there's a motion and a second. And if we want to call the question, I'm happy to second that because I think, it's almost 6 and we've got 12 more items on our agenda.
I'll be supportive, but I think that we do got to find some sort of equity tool mechanism, whether it's the lower cost for the independents, lower the cost, or and keep the regular costs for the other ones, but do what Supervisor Cummings is saying. Okay.
Yes, and that is our recommendation. That is if you are going to be subsidizing the costs, that we recommend doing it just across the board.
Okay. But to continue working on finding a better system. Okay. So we have a motion from Supervisor Cummings and a second from Supervisor Koenig. Okay.
Supervisor DeSerpa.
Aye.
Cummings.
Aye.
Martinez.
No.
Koenig. And Hernandez.
You almost forgot me again. Aye, but I do want to see a better solution come up too. Moving on, item number 10. Consider the approval of the County of Santa Cruz proposed 2025-2026 budget with last day concluding and related actions. Approve the continuing agreements list and fixed assets for 2025-2026. Take all related actions. I'll turn it over to Marcus Pimentel, our County Budget Manager, for the presentation.
Thank you, Board Chair. And I do recognize you have another budget item after this and 11 more items from this
11
morning.
more items.
So we'll keep this brief. I'm here today with Delana Martinez Davis, our Senior Administrative Analyst for Department. Again, we're on the backdrop of the federal government making some incredibly huge, impactful, negatively impactful policy decisions that are going to reduce eligibility, reduce costs, reduce funding to the state of California, to us directly. And then the state's going to react and reduce their contributions, funds, and eligibility to us. So we're going to have a cascading impact from federal actions. They're going to land on us in the coming months. Right now, we already know the Senate has come out, the California Senate has issued a alternative to the governor's May revise on June 9th that thankfully is proposing some lower reductions, not eliminating the reductions, but lower reductions in the eligibility, delaying some cuts. But there's still cuts coming, and we'll get more details over the coming months. With that, we're just going to recap a little bit of where we're at the budget hearing. We should have about 10 minutes. We'll go pretty quick because you've done all the heavy lifting up to this point. I'll turn it over to Lana Martinez Davis.
Good afternoon. So with all of the last day and concluding items, we're up to about $1.24 billion budget. The majority of the additions are in the general fund and the special revenue funds. I'll note too that the from item 7, the radiology positions are not currently in the summary of the actions there on the left of the slide, but those will be added with the concluding actions. So the position change from the last day is about 9.6 positions. Again, this doesn't include the 2.0 FTE radiology positions. The 5.6 and 2.0 radiology positions will, per the direction of the board, be continued until September 30th. The other positions include the ones from the Board of Supervisors, sheriffs, child supports reductions, HSA, and then from supplemental and last day, the 8 positions added to CDI, and then the 1 analyst position added in Measure Q, and then the 1 senior mental health client specialist position that was added, restored for a full fiscal year. Bringing it back to Marcus.
Yeah. So despite that opening of what is to come, it's going to be painful and challenging and horrific to some extent. This county has continued to be impressive in what they've been able to achieve, despite being systematically underfunded, despite being understaffed in a lot of ways. And we continue to be remarkable in what we can and are willing to do and have done. So this budget represents a lot of achievements. We encourage all of our readers to go through every department's page, look at their achievements, look at the emerging issues to see what's coming down the pipeline. And there's some good opportunities in there as well as some threats. As a recap, we are proposing still a balanced general fund. We are fully funded, so that is an incredible achievement at this point in time. We do have some out-year deficit projections that will likely get worse in a couple months, so stay tuned for that. Our cash reserves remain at above our target level, but as we talked about, we're below our peers. Our peers would have a funded level of $200 million, and we're half that size in our cash reserves. Half our cash reserves are dedicated to FQHC system supports. So really, we're down to 3 payrolls. You've heard this before as a challenge. Again, what we're really going to be facing in the coming months is by Sunday, the state should have an adopted budget. often those details are still light. There'll be trailer bills that will continue through the month of June. And then there'll be budget junior bills that happen in July, August until the final is done. It could be September, or could it be October? This will be a longer season for the state because they'll likely be reacting to the federal budget and may not finalize their budget until the feds do. So we'll have to see where that happens. Once the feds finalize their changes, reductions, and impacts to us, the state will then react and we'll be able to come back to this board. We're thinking that time frame is starting in September, could be October, depending on when we find out the information. But we're going to be as responsive as we can going into next season. Our obligations are to have a balanced budget approved by the board today. And so we can start at the beginning of the year on July 1st. There's a lot of work to do from today to July 1st to get all of our activities in line. And then we come back to present the adopted form of the budget on September 30th to go to the state controller's office. So we're still in line to meet all of our legal mandates. What I'll finish with is just a little bit of, in this time of stress, and there's been a lot in this time of heavy level of uncertainty. I think I've seen this 4 times in my career. I've been working since 95. There's been 4 times in my career where I feel like this uncertainty is just unsustainable and it's overwhelming. CEO Palacios has mentioned, it feels like things like the Great Recession, although this is being driven kind of from a single source and not from an organic, environmental, organic, natural disaster, or an organic economic event. It's being driven by some policy considerations that are cascading down across the entire country. I do want to acknowledge and give deep appreciation to all the staff in our departments who to this point in time have complied with all of the direction you heard today Carlos talk about. This was a hard year for departments. There was a lot of need across the departments, and they had to take the word no and smile with it in just their initial request before they even made it further along in the process. And that was challenging. They all comply with our budget direction. And we presented on time a balanced proposed budget to this board and our community in the month of April, which was really impressive given all the work that needed to get done on the backdrop for probably a 3rd year in a row of a different backdrop. It was disasters, and then it was funding the disasters. And this year it's doing all the work weekly about understanding what are the federal impacts, what are those threats. So that's been happening in parallel to all this behind the scenes. And as you know, the news changes daily or weekly or by the minute, trying to assess those impacts. So on that backdrop, the county departments and their budget teams have done a phenomenal job to get us the information we demand over and over again in different ways. Because it's really been a challenging year. So I want to acknowledge and appreciate every single one of them. In particular, I want to acknowledge Juliet Burke and her staff, Elizabeth Padilla, Lori Betancourt, Petra Rocha Martinez, Helen Bale, and our newest, Delissa Escobar, who joined us. It's been a challenging year for them too. With all the budget hearings and changes. I'm going to give deep respect. We have a very small but mighty budget collection team. We kind of get together voluntarily and figure all this stuff out. And some of that is led by our ACAO, Nicole Coburn, to my left, Lana Martinez Davis, Ryan Friedrich, who presented the CIP, and myself. We've kind of been pulling this together with a whole team behind us who've been volunteering and stopping some of their work. I want to talk about Melody Sereno, our ACAO, who's been behind the scenes giving guidance and helping prepare a lot of our documentation. Our principal administrative analyst, Finn Stafford and Peter Detlis, David Brown, our senior administrative analyst, Gina Martinez-Coons, and George Intis, and our executive secretary, Danita Gonzalez. And I'm leaving out one person who she just celebrated her birthday. I'm not going to mention the date or the age, but Mika White is an incredible asset to this county behind the scenes in administration for our department. She's been creatively pulling together how we can dynamically produce a document in a way that's timely and effective and giving us a lot of opportunities. I just really want to give a shout out to Miko and the team behind us in ISD who's been helping pull all this together. And it's my honor to serve under CEO Palacios, Carlos Palacios. He's been leading us consistently through this challenging year and these challenging years behind us, along with assistant CEOs, Elisa Benson and Nicole Coburn, and our deputy CEO, Melody Sereno. We're just really fortunate to have that leadership team behind us. I just want to end there with some gratitude and thanks because it's been a tough year. And I'll finish with thanking each and one of you as you've demonstrated how challenging this year has been. No matter how big or small it is, there's not been an easy decision that's faced this board. And I just appreciate the effort and the level of response and the questions you've been giving us all year. So with that, I conclude this year's budget hearings, except for the item that was moved after this.
Thank you. We'll open that up to the public to see if anyone would like to make any comments on this item. Seeing none, we'll go to the online. Seeing none, we'll bring it back to the board to see if we can entertain a motion. Supervisor Cummings.
Yeah, I just want to thank you all on all your hard work and starting back, I guess it was in May, we had our first hearings. We've been having those throughout June, and every year it's a challenging time. And I do actually want to thank the public too. This is since I've been, whether it was on the city council or the board of supervisors, I don't think I've ever seen this many people come out to budget hearings. And so just really want to thank members of the public for their participation. It's obviously a really challenging year. We're going to be back again in the fall, but I think you all have worked really hard to get us to a place where we're going to move into the next year with a balanced budget. And I think that's one of the most, that's the best we can ask for under these really challenging circumstances. And so I'm happy to move the recommended actions.
Second.
Could I ask staff one question?
One.
All right. So I just want to unpack one thing in here, which is concluding actions and budget hearings, item 10. A bit of a cryptic paragraph here. Authorize the auditor, controller, and the county executive officer to rebudget all unexpended balances and appropriations in the capital, former plant acquisition GL keys within the capital project funds, including District 1 and 2 allocations of $75,000 each set aside in capital contingency for parks improvements as part of the transient occupancy tax, neighborhood improvements, and interest to adjust the appropriations of the various park dedication budgets for excess available financing by increasing the land other object. Is what's happening here? So the clawback of any unspent funds
there's two things going on there. One, that's an error on our part. That 75,000 is this board has already directed. We're repurposing that into the health department. That should have been removed from the language. What that particular item does is we have capital projects that have multiple span multiple years. And so we'll end the fiscal year and any contract amounts or CIP amounts that are still ongoing, we'll carry those over from this year into the next year. So it allows us to keep multi-year projects alive. Without that, the funding, any unspent dollars would end and the project would die 25% of the way through. So this allows us to keep the funding going.
So any unexpended revenues from 24
carried over
would carry over.
Yep.
And as you mentioned, the 25, 26 revenues would be I think they were allocated to contingency.
Okay, we have a motion from Supervisor Cummings and second from Hernandez. Can we take a roll call vote?
Supervisor DeSerpa.
Aye.
Cummings.
Aye.
Martinez.
I'm going to be voting aye with an abstention on recommended action number 2 on the continuing agreements list, any contract with Encompass Community Services.
Supervisor Koenig.
But I want to make it just clear to my colleagues that what's happening here is we are pulling back transient occupancy taxes that were explicitly by resolution in the past dedicated to neighborhood projects in 2 affected districts. So I'm willing to do that given the difficult budget year we're facing, but I think we do need to look at it in the future as a way also to equitably share, ensure that these sorts of neighborhood projects are possible across the county.
Supervisor Hernandez.
Aye, motion passes unanimously. Yes. Moving on to measure 10.1, measure Q. Let me read this item here. It's back in the other file. Accept and file the report providing detailed cost estimate information for Water, Wildfire and Wildlife Protection Act, Measure Q operations and administration for budget fiscal year 2025-2026. And we have a presentation from OE.
We're just here for answer questions.
Okay.
At this point, we're here to answer questions.
Yes.
All right, so I maintained that, pulling this item, unless Supervisor Cummings wants to lead with anything. One thing we consistently heard from the community was a concern over staffing costs. And after the last meeting when we discussed this, my staff was looking at, specifically the staff that's being proposed for hire, which is a senior admin analyst in the CEO's department. We identified another comparable position, a senior department admin analyst, which is actually $20,000 cheaper And when you read the position description, sounds a heck of a lot more applicable. The department analyst actually prepares and administers grants and contracts, including the financial program and components, conducts needs assessments, and assists department administration to prepare long-range program plans, may serve as the staff representative to commissions, committees, and task forces. Whereas a senior admin analyst in the CEO's department, the position description is a lot more analysis-based, analyzes department workloads, recommends staffing patterns, performs complex budget analysis, and oversees budget conformity for multiple county budget departments. Meanwhile, we've also heard some concern. I mean, the measure language does say that both the department, meaning the Parks Department, and the office, meaning the Office of Response Recovery and Resilience, are going to have to collaborate on this. And so there was concern about putting, really all of the staffing firepower in the Office of Response Recovery and Resilience. The admin analyst can only go in the CEO's department. The department analyst can go in either ultimately. And so I'm just curious what consideration, if any, was given to this by
I think from our perspective, knowing the market of analysts and trying to hire this promptly, we will be more competitive with the higher, the one that fits in the senior administrative analyst role. If you all decide that you don't support our recommendation, we can go with a lower analyst, but we may have a harder time filling the position.
I mean, 190 in compensation versus 170,000. Yeah.
And I hope not to fill it at the highest part of the scale.
Mm-hmm. And any, can you speak at all to concern about workload between office and department?
I'm not concerned about that, given the partnership that we've established so far. And this was a recommendation that we came to together. So I'm not worried about the fact it would be sitting in OR3. I do want to say one other thing, though, around the senior department analyst track versus the senior admin analyst track. All the other analyst roles within OR3 are senior administrative analysts. So it sets us into a different structure within OR3 if that was the direction of the board.
Okay. Well, I mean, I guess my thought also is, especially if there is this board directed funding, is that probably the projects that we're considering might be a little bit more parks related than just OR3 related. And I mean, a department admin analyst in the Parks Department would actually have a little bit more staff support around them. So, for the, I'll propose a motion to accept and file the report, but approve the addition of one FTE senior department admin analyst in the Parks Department rather than the senior admin analyst, which is a CEO specific role.
So let me just comment on the part of the rationale is, again, this is not just to hand out the board's money at all. This is to advise the COAB, the whole community board, on the $3 million of grants, right, that they're going to be handing out for the entire Measure Q budget. And the vision is not that they're just going to sit there and hand out money to local nonprofits, that they're going to leverage grants, Prop 4, other grants, region-wide. So this is a person that's going to go and negotiate with city managers, that's going to go and meet with other county officials. And so part of it is having that person in my office gives that weight. So when they go meet with Monterey County, they're coming from the CAO's office, or the CEOs rather, and they're actually talking about a multi-jurisdictional project, right, that we're trying to negotiate, or they're talking with state officials. Again, I'm trying not to have a narrow vision. I'm trying to have a big vision. And the idea is not to hand out $3 million of grants on their own, but to leverage multi-million dollars. And so I wanted to make sure, and this is my direction, a person at the highest level we could get, and in my office that carries the weight of my office, which makes it a big deal to other jurisdictions. Because believe me, if they make an appointment from the Parks Department versus the CEO's office, it makes a difference when you're talking about a state department, when you're talking about another county. That's part of the rationale. And that's why part of what's driving the recommendation.
Thank you, Supervisor Cummings.
Yeah, I initially pulled this because I was confused coming into the meeting of where the Measure Q allocations were, and when I looked into here, I didn't see them. But then after looking through other parts of the agenda, it became clear where the board allocations were. So that's why I was going to recommend putting it back on consent, because I kind of figured out like where the.
I apologize for the confusion, and this was just around the administrative operations budget, not the larger implementation of the county bucket.
Yeah. And I'd also would, I'd grapple with this question of like, where's the appropriate place for this to go? And I had some conversation with Supervisor Koenig. And so I've been also kind of interested in the same question about, what's the best place, but I'm open to hearing what the board has to say on that.
I have nothing to say unless someone wants to recommend a motion.
We need to go out for public comment on this.
That's right. Anybody in the public wishes to address us?
Oh. All right. Good evening, board, Chair Hernandez, board members and staff. Thank you for the time. It's been a long day. My name is Eric Lombardo. I'm the External Affairs Director at the Land Trust of Santa Cruz County. My comment relates to the Measure Q budget item, but I just want to acknowledge a lot of other hard decisions that are being made by the board, many of them due to federal and state funding pullbacks that are out of your control. So thanks for all you do in making this budget happen. And that goes for staff as well. So just want to mention that this is a really important moment to fulfill the intent of voters who overwhelmingly passed Measure Q in 2024. This is a real bright spot while we have so many other funding sources that are constrained. In my comment, I just want to bring us back to the ordinance language that was passed. We understand that the new position that is proposed, that's being discussed here, will lead management of the Measure Q grant program and other important duties. I want to speak to the act language that approved by voters that states that the Parks Department and the Office of Response, Recovery and Resilience will co-administer those grant fund programs and make joint recommendations to you, board. It's not really my business to get into exactly where these things are to be placed or what level they're at. I just really want to reference that voter and approved language. I also want to agree with CEO Palacios' comment where he noted that both today and in the previous meeting, that this role would be best serving as a strategic collaborator that can identify those funding opportunities to leverage Measure Q dollars and bring larger public benefits to our community, bringing those grants in to the community. So just wanting to honor the intent of those voters and ensure that both county parks and OR3 can jointly coordinate this position to further the goals of Measure Q and the county's goals to serve our communities through world-class parks, climate resilience solutions, disaster preparedness. Just honor that intent that those department and the office are jointly managing these Measure Q funds and recommending to the board. So thank you so much for the opportunity. The Land Trust looks forward to remaining involved as we continue with implementation.
Thank you. Anyone online?
I have no speakers online, Chair.
I'll bring you back to the board to entertain the motion.
If there's at some point I can comment on this question about parks and OR3, I would appreciate that opportunity. I think the information that I provided with detailed hours demonstrates a shared commitment and approach to how parks and OR3 will both be involved deeply in the administration of Measure Q, in the work with the COAB, with the work with grants. That's where we show those indirect staffing costs and who will be involved in that. And as the assistant CEO to whom those departments report, I mean, I'm going to be continuing to be having them talk about it with me, ensuring that unified yet still specialized perspectives that they each bring, that's part of what we're looking for. We don't want just a parks perspective, and we don't want just an OR3 perspective. And it's the power of the diversity of those perspectives that is going to really help us get to that level of collaboration. So I'm very in tuned with the language and very in tuned with how this is going to be moved forward. We made this recommendation based on, I think, the way things will work best given where we are in the program.
Thank you. Seeing that no one's willing to move this forward, I will make a motion to accept and file a report providing detailed cost estimates information for water, wildfire, Wildlife Protection Act, and Operations and Administration Budget Fiscal Year 2025-2026. I'll make the motion.
So I have a question for clarity. I thought I heard a motion from Supervisor Koenig earlier. Was that on the, that wasn't seconded?
I did make it, but I think it wasn't seconded, and it was before we took public comment. And so,
Okay. Got it.
I'm
So have you retracted that motion?
well, I was waiting for a second on the chair's motion.
Is your motion the
Staff
recommended
report,
action?
yes.
Second.
All right, we have a motion and a second. Can we take roll call vote?
Well, I guess for the sake of discussion, I'll offer a substitute motion, which is that we accept and file the report, but approve the addition of one full-time senior department admin analyst in the Parks Department rather than the senior admin analyst, which is a CEO-specific role, understanding that, of course, the more flexible department admin analyst could move in the future, and that this does not preclude members of the CEO's office from meeting with other counties or state departments if needed.
I'll second for the purpose of discussion.
Anybody have discussion?
Well, I don't know if it's the time of night and I'm very tired, but you talk really fast. Could you just say it again and slow it down?
Okay.
Because I'm trying to get my mind around it. So are you suggesting that we instead move this position from OR3 to Parks?
Correct. And they use a different classification that's about $20,000 cheaper.
Thank you.
There's any further discussion? Supervisor Martinez?
I understand where the motion is coming from. I think that there's a concern that the parks emphasis in the measure might be lost if it's in OR3. But given the response to that I heard from our assistant CEO, as well as CEO Palacios's recommendation that the position come from that office, I think that's compelling. And this is, I keep saying it's the first time we're doing this. I want to do it right. I want to establish it correctly. And, no disregard at all to the Parks Department, but I do think that greater weight comes when it is in the CEO's office. So I would not be voting in favor of the motion, but rather the recommended actions if that were to come back.
I will not be voting for this either.
And I neither will.
If we could, Supervisor DeSerpa,
Can we just call the vote?
call the vote.
And to clarify for the record, this will be the vote on the substitute motion coming from Supervisor Koenig, as seconded by Supervisor Cummings, relocating and reclassifying from the senior analyst, the senior departmental analyst in Parks. Supervisor DeSerpa.
No.
Cummings.
Aye.
Martinez.
No.
Koenig.
Aye.
Hernandez.
No. Can we go back to the first motion, staff recommendation? Can we take roll call vote? Thank you.
Supervisor DeSerpa.
Aye.
Cummings.
Aye.
Koenig.
Aye.
Martinez.
Aye.
And Hernandez.
Aye, motion passes unanimously. That concludes this agenda. We're going back to the morning agenda.